welcome to the
Good morning.
county.
Thank you. Perfect. Thank you, Pete.
You bet. Well, everybody, I thought we would start with the nonprofits today and then work our way to the county people. So commissioners, how would you like to do this? Would you just want to go down the list?
Yeah.
Okay. So the first one up is relative theatrics. And I think, Ann, I think you're on board here. Are you still here? You're muted, Ann. Go ahead. Could you just give us a little background to your project so we have a little bit of better understanding than just the narrative you put forth?
Absolutely. Well, good morning. Thank you. So, excuse me. So what we're proposing is to essentially be producing 6 shows, 6 theater productions that would speak to any contemporary issues that the county is currently being faced with. And through that, then providing access and resources and means to use the storytelling as a conduit for community engagement, for building more inroads and strengthening the fibers of our community, and for working directly with nonprofits to help elevate whatever needs or issues or conversations would benefit from being amplified in our community. Furthermore, we would want to approach all of this with a very just and equitable lens. And so in addition to ensuring that all of our artists are receiving fair compensation so that they can make a living doing this, that we also would be providing access and assistance to patrons, giving away free tickets, and acquiring childcare and meals and transportation for the productions, so that all around we're addressing access issues and really creating a place where everyone in the county, in the community, can feel that there is a sense of belonging and a place for them here at the theater to build empathy and resiliency, to address mental health, and to live a better life.
Yeah, commissioners, any questions?
Yeah, and I just have one question. Any chance that participants in these productions would be from some of these groups that aren't normally seen in a theater?
Absolutely, and that's one of the reasons that that we are proposing a stronger budget for artist pay, because it's absolutely unfair to put the burden on other communities or historically underrepresented communities without offering fair financial compensation for that time, for the energy, for their contributions. But there would be a strong component of relationship building to not only have invitations and inroads to come view the theater, but to participate as well. Yes, that would be the goal.
Anything else? Commissioner Richardson, anything?
I just am struggling to understand the nexus. I guess I don't know, maybe I don't understand the ARPA. That's a broad topic, so we should just keep going.
Okay. All right, thanks, Ann. I appreciate it.
All right, thank you. I mean, I will say, ideally, this would be using the theater as a means to amplify all of the amazing boots on the ground work. It is a conduit for storytelling that has a real impact and can spark action to address all of these inequities. But then through practice, we also would be addressing that as well. But if any further questions come up, I'm more than happy to address those.
Yeah, Sue, go ahead.
I'm sorry, and I should ask you this early. Should you not receive ARPA funds, will this go forward or not? As far as these 6 productions?
Well, it's a part of our mission to continue to present plays. Likely, if we do not receive the funding, then much of the structure of what we're proposing here to accommodate needs to be able to compensate individuals for their work in sharing their stories and really addressing to the community, to the public, the struggles that we all are facing on different levels as a result that have been amplified from this pandemic. So we likely would not have the access for food insecurity, for childcare, transportation. The wages would not be fair. I mean, so yeah, if we don't receive the funding, then we'll sort of continue to do business as normal, but it won't have the greater impact that this community really needs.
Thank you, Ann.
Yeah.
Thanks, Ann. Next up, Hospice of Laramie. Is anybody, yeah, go ahead, Evelyn.
Jessica is with the patient and she said she'll be here as soon as she can, but she asked if she could be pushed back to the end of the list.
Okay. How about anybody representing Laramie Connections? Is anybody here representing Laramie Connections? Or how about online? Okay, we'll put those, see if they'll come up again. How about Laramie Salvation Army? Okay. The open school? Anybody for the open school?
Shelly Mcfadden is on.
Hi, Shelly. You're still muted, Shelly.
All right, there we go. Sorry.
There you go. Good morning.
Good morning,
and
commissioners.
can
Thank
we
you
just
for
get a little
your time
more-
this morning. What's that?
Can we just get a little bit more for your, than your narrative here about your project, please?
Okay, thank you. Good morning. Thank you for your time. My name is Shelly Mcfadden. I'm the director of the Open School. We're a nonprofit childcare preschool in Laramie. We're celebrating our 50th year serving Laramie families. The last 18 months have been very challenging, as you all know. We had to reconfigure how we operate and how we serve families. We are currently open and serving 50 families. We have 17 employees. Of those 50 families, we have 45 families that are essential workers with UW, county school district, medical workers, police, fire, state, city. So it's important that we're able to keep our doors open, serve these families, and keep our employees employed. We did have a brief closure last March while we figured out how to redo everything, and that really hurt our families and our employees. So we're trying to do our best to move forward and keep everybody employed and have the kids have a safe and educational place to be, and provide parents peace of mind that their kids are somewhere safe as well. So we've been doing all the things asked of us, CDC, public health, wearing masks all day, extra cleaning, all the things. And it's really just taken a hit on our budget. We have 18 open spots that we're not filling so we can social distance. We're keeping classes in cohorts so they don't intermingle in case we do have a positive case. So it's just challenging. What we're asking for your assistance here is money to help our supply budget so that we can continue buying masks and gloves and all the cleaning supplies so we can continue to go above and beyond and not close our doors. We've had one 4-day closure since we reopened last August, and that was just to test the class and make sure everybody was safe. And the other part of it is to pay for our staff when they have to take time off to test. It takes a couple days to get their test results. So just to be able to provide them some paid leave while they're testing, because they're not allowed to come to school with symptoms, the same as kids can't come to school with symptoms. So just a little bit of assistance to help keep moving forward and doing all these measures to keep our doors open and keep serving families and children.
Thank you, Shelly. Commissioners, any questions? Yeah, go ahead, Sue, please.
Shelley, you said that you have openings for 18, but you're trying to comply with COVID recommendations and all as far as distancing. So how many students do you have right now? What's your population right now?
We have 50 students right now.
And normally you have 68?
Yes, normally we have 2 pre-K classes that can have 24 and 1 preschool class that can have 20. And we're at 50 total.
Thank you.
We'd like to increase that as we'd like to add more families. We do have families on our wait list, and it's important that we can get back to full capacity and serve families that are on our wait list. We're just waiting until things improve. So we, like, when they're eating lunch, for example, they have to sit 6 feet apart, or they would be considered exposed if they, we had a positive case in the class. So we're having to get really creative on how they're unmasked during the day. So we just can't fill our classes to full capacity, but hopefully in the spring, that's something we can get back to, or summer, fall by the latest, if we're being optimistic. So we can get back to that full capacity serving families and helping our budget too, but we do have families on the wait list.
Thank you, Shelley.
Commissioner Richardson, anything?
No, my wife was on the open school board, and it's cool. It's a good school, and I don't know how they're staying solvent, when the fixed costs remain, even when you sort of by requirement can't fill all of your numbers. So I don't really know how Shelly is doing it, but I admire it. And I know she does a great job.
Yeah.
So
Shelly, could you tell me what a spot in the open school costs for a year or a semester, how that goes?
We bill by the month, and it depends on the enrollment. We offer customized packages for parents to kind of meet their needs. So like 3 mornings would be our minimum package, and that's $246 a month. And a full-time package for 7:30 to 5:30 Monday through Friday would be $784 a month. And normally, yes, tuition kind of keeps the lights on, pays the wages and keeps the lights on. So decreased, we're missing 18 spots. It's a mixture of part-time and full-time enrollment that's not in our budget every month.
Shelly, do you guys offer scholarships for low-income folks, or is that not something that you do?
We don't. We try to work with families, and we also accept DFS funding. If they're eligible for DFS assistance, we'll work with that. During this last 18 months, we've had some families apply for waivers if they've had hardships, things like that. And we try to, the board looks at the picture and tries to work with families, but.
So it's just capacity space-wise that's keeping your 18 spots down. If there was a way to do something different, if you had a bigger facility, then you could house those 18, is that my understanding?
Yeah, if we had the room, the square footage, and could manage the 6-foot social distancing when they have their masks left to eat or rest, things like that. Like I said, I'm hoping once things change and we don't have to worry as much. We have one classroom that's mostly 5, so when they start getting vaccinated, if they choose to, things like that, we'll see some improvements. But it's mostly right now just for the impacts of the social distancing. Keeping classes in cohorts means that I've increased my staff, where I might have been able to mix staff into one room at the end of the day for after school. Each class has to be in their own space for after school. Things like that, just the challenges of, keeping kids in masks all day, just all the things. It's just easier on staff as well, besides the space, just to have less children in a day to kind of manage.
Is your wait list more than 18, I imagine?
Yeah, I'm sure. I haven't counted it recently. We've got people calling regularly. I've got a lot of people that want to start in January, and we've got a wait list for next fall that I'm hoping to definitely add all those people in by next fall.
Okay. Thank you, Shelly. I appreciate it.
Thank you.
All right. Next up, I have Larry Main Street. They don't have a project, but Trey, do you want to jump in here and tell us what you're thinking? Good morning.
Good morning. Thank you, members of the commission. I'm just a collaborator, right? So I know that there's a ton of good work going on in our community, and I wanted to make sure that if any of the partners who are applying for American Rescue Plan funds need an economic development partner or a community development partner, that Main Street would be here to rise to that occasion. So I'm just here to say if anybody needs assistance with their project or making connections or collaborations, I'm here to help.
Thanks, Trey, appreciate it. Commissioners, anything?
No.
All right. Laramie Connections, I don't believe anybody's here from Laramie Connections yet. Next up, Laramie Reproductive Health, Naomi, please. Next.
Thanks for having me here. I'm really excited about our proposal. The biggest funding that we're requesting is for a mobile medical clinic, so that we can serve Albany County specifically, but we're also looking at potentially moving outside of Albany County. So what you have in front of you, the first page is a little bit more of an extensive write-up on the proposal itself, in addition to the $500 character letter of intent that was submitted. Next is the Wyoming Health Council request for proposal that I recently submitted. This is to help support the fact that we also have additional funding for this project in addition to the American Rescue Plan Act. So Title 10 right now is being allotted about $256 million for expansion efforts. And of course, Wyoming is really interested in this as well. There is a couple of areas within Wyoming that currently do not have a Title 10 clinic. It's Eastern Wyoming, Western Wyoming, and Fremont County specifically. So this specific, the Wyoming Health Council proposal that you see, this is specifically for telehealth expansion, which is great for those areas that have broadband or telephone to begin with. But one of the biggest hurdles we found is that in order to start someone on a birth control method, we really at least need a blood pressure. And if we look at trying to expand into telehealth, if we go into these communities in these areas via telehealth, there's still nowhere, there's no facility, there's no library, maybe there's a post office, but there's nowhere for us to even go and take a blood pressure, much less be able to really give someone comprehensive care. We know that although we focus on reproductive and sexual health care, you know, we do annual wellness visits for a variety of people who don't otherwise see a physician. We certainly do STI testing to reduce community transmission of infectious diseases. So our reach goes beyond just contraceptive methods as well, which I think is important. So the Wyoming Health Council proposal is just to help solidify the fact that we are working with other partners for funding on these projects. The next two bits of information you have are the proposals on the mobile medical clinic units themselves. The first one is like our wish list. This is the upgraded version. It has a diesel engine with 4-wheel drive. The other one has a standard V8 engine. Both of them would allow us to expand our services because they have medical fridges in them. So we'd be able to start doing vaccines. And two, this is a community, we feel like this is a community initiative, both with the grant and our mission within the community. So we do hope to be able to partner with other community organizations to expand our vaccine outreach, or if we can take food with us to certain places, or if there's other needs in those places that we can help facilitate and work with other local community organizations to get to those areas, even just within Albany County. I think we can make a great impact. The next two sheets of information are information on the computers that is in the proposal as well. These computers will replace all of the computers in our clinic. Some of these have been replaced by other grants, but this is the last bit to replace all of the computers in the clinic, which are outdated. And also in the proposal is for sensory faucets, so that we can implement sensory faucets within the clinic, in the bathrooms, in the clinic areas, and for COVID to help prevent the spread of disease. But we just don't have money in our budget for things like sensory faucets. So that would be a wish list as well. And so those are the main points on our grant proposal, and I'm happy to answer any questions that you may have.
Commissioners, any questions?
Oh, the second quote, the B8, the second quote, at the end of that one, it has the floor plans for the medical trucks themselves, which I think is pretty cool. The other one, the upgraded one, should be pretty similar, just slightly different, but bigger engine and four-wheel drive.
And so Naomi, your intent is not just to serve Albany County, because I know, being a volunteer for LRH, that you also get clients from Carbon County and.
From a variety of
Yeah, so
counties
would
throughout
you
the
be
state.
taking this mobile?
Potentially, yes.
those
Part of the Wyoming Health Council grant that's included in here is to provide salary to do the research on what it would look like to go to these outside counties. Like, what do we need to do to make that happen? Who do we need to collaborate with? What resources do we have? How does our insurance coverage policy, premiums change? Those sorts of things. So yeah, the potentially, absolutely. And that will help to be funded through the Wyoming Health Council in Title 10 if we are able to make that expansion happen.
Naomi, would this require more staffing? I'm guessing it would.
Of course
How
it
would
would,
you-
yes.
How would you pay for that?
Well, so we'll have expansion money through Title 10 to be able to expand our staff. But we also accept insurance in addition to offering services on a sliding fee scale. So just because we go to a location doesn't necessarily mean that they don't have insurance or means to pay. So that will hopefully help to offset the costs. And of course, we'll continue our grant funding as well.
Thank you. Any other questions?
Yeah, this is a lot of information, Naomi, that we did have beforehand to look at. So as far as the Title 10, you've only requested 10,000. Is that a cap for them or?
That's just for this submission. So, so coming up, due on December 1st is our next grant cycle application. And so we're to build in all of our wish lists into that grant application. And so I'll roll these things into that grant application as well to see if our regular annual funding will also help to offset these costs, right? Because yeah, definitely staffing and personnel costs is our biggest expense by far. And there's certainly a concern with, low clinical staff and the availability to find them. But we also think that expanding to other parts of the state will help with that outreach. We could stop by, pick up a doctor on the way from another community and really start collaborating with other outlying areas within the Wyoming frontier as well. So I think there's potential.
Thank you, Naomi. Appreciate it.
Thank you.
Cathedral Home. Is there anybody from Cathedral Home here this morning? Cathedral Home. All right, so Laramie Soup Kitchen. Ted, are you up this morning?
I am, yes. Can you hear me?
Got you loud and clear. Thanks. Could you give us a little bit more about your project, Ted, please?
Sure, absolutely. Thank you for this opportunity. This is pretty exciting for us. What we're looking at is really think that the priorities that we set up in our proposal match the goals of the American Rescue Plan Act in a number of different ways. One of the first ones is that we set up a number of months ago, especially when the pandemic first started to wane, 4 priorities that we really wanted to accomplish before we would reopen to congregate meals. Now, granted, we've added one to that, which is that the CDC still doesn't recommend congregate meals in low-income populations, people who don't have access to good healthcare, things like that. So essentially the population that we serve. But we would really like to put into place everything needed so that when the CDC does drop that recommendation, that we can reopen our doors to congregate meals. And so some of those priorities are different seating. We have set up a mini cafe down in the soup kitchen if anyone's interested to come see it. That kind of showcases what we're trying to do. And these tables are so much nicer than what we were using. It does provide a lot of spacing opportunities. And also if an individual, for example, does not want to share a meal with a person in a particular day, pandemic or otherwise, that also enables them to do that with this new seating. Another piece of this is that we need to change our serving line over to completely served. When we talk about risk management, what we were comfortable with in the way of risk has significantly changed over the last 18 months. And we feel that it's really in the best interest of our clients to switch over to a much safer serving line where everything is served. We still want to give people all the options that they want and things like that we've always done, but we want to make sure that we can do it in a very safe way. And that involves changing over to some like refrigerated merchandisers, for example, for some of our desserts, so that people can still see everything and then they can talk to the volunteer and be served a particular dessert or a particular salad or whatever it ends up being. I think that the other thing is that one of the big priorities of this act is premium pay for essential workers. We received a declaration of being essential workers at the beginning of the pandemic from County Emergency Management. And we really looked at what it costs to increase pay, to give that premium pay. And we have two sections within our proposal. One is for the current pay for employees, as well as retroactive pay. Also a priority of the act. And the retroactive pay is for both our part-timers especially, but then also for our 2 full-time employees, of which I should mention I am one of them. And then, I mean, this is pretty minor, but broadband infrastructure, it's actually specifically listed in the act. And it's very minor. It's probably the smallest ask of all the different things that we've incorporated into our proposal. But it will help us make sure that we have quality broadband available to our guests, something we've been really struggling with and trying to accomplish over the last couple of years. And I think that this will help us get us there. But other than that, I can answer any of your questions.
Thank you, Ted. Commissioners, any questions?
Yeah, Ted, how many part-time employees do you have?
Yes, Commissioner Ibarra, thanks so much for that question. We have right now, we're actually about a third staffed. So we have 2 food recovery specialists and we have 2 kitchen assistants. One of the food recovery specialists we actually just hired last week. And so he wouldn't be able to, there's no retroactive pay that would be included for him because he didn't work with us through the pandemic. And then we're trying to hire another 2 kitchen assistants. So in the end, we should have 6.
Commissioner Richardson, please.
Ted, I'm wondering if you can give us a rundown sort of what kind of volunteer hours you had before the pandemic and how the pandemic has affected your ability to attract or accommodate or, have volunteers in there to work to help do what you do. Absolutely.
I'd be happy to answer that. Commissioner Richardson, thanks for that. So volunteer hours before the pandemic, new volunteers ranging between 200 and 300 people. That doesn't include our regulars who come back time and time again. Total logged hours over 5,000. During the pandemic, as precautionary, and it worked out very well, as we never closed the soup kitchen due to the pandemic, we stopped allowing volunteers. We've since created a volunteer program where people sign up. That way it gives us a lot of control over how many people are coming into the space. We don't get overrun with groups of 20 like we used to. Unfortunately, while October was about 60% filled, those positions that we've opened up, November is 30%. So what's really interesting is when we talk about labor shortages, it's also volunteer shortages. We were really hoping to be able to balance more staff to volunteers because volunteers are wonderful and free. But right now we're still pushing the volunteer program as much as we can. And Sarah and I actually just had the conversation last week about whether or not either during our strategic plan or during next budget session, which for us will be in like May, June, is if we're going to go to our board and ask for more staff. So we're barely scraping it by right now. And we're hopeful that volunteerism will increase again, but just as people aren't coming out to work, people are also not coming out to volunteer.
And Ted, traditionally, has your volunteer basis come from UW, a major source?
Absolutely, yes. Most of them do come from UW, and actually that's where a lot of the new volunteers come from, is the service learning components that are involved. We're usually engaged with 5 or 6 different colleges or classes across the university. So that's another thing that we are considering is that with a return to more in-person classes next fall, we are really hopeful that those service learning components are going to come back to those classes, and that we're going to see a lot more students. It's so wonderful for the nonprofit sector. I believe it's a long-term investment to work with students as often as we possibly can, because even if they don't support us now, getting them engaged now, they're more likely to support the nonprofit sector in the future when they have careers.
Thank you, Ted.
Then with regard to the premium pay, are you just thinking it'll be a bonus, or how do you continue us or make this sustainable if it's adding salary?
Absolutely, Chairman Gosar. So first of all, we're looking at the difference. So we're not asking for the base pay of what we were paying our employees, let's say a year or 2 years ago. We've already covered that. We've already established that in our budget, so we're covering that. So we're only asking for the difference to bring up into premium pay. And so for part-time employees, for example, before the pandemic, staff were very comfortable. One staff person in particular worked for us for 3 years. And at the end of her 3 years, she was making $10 an hour. Recently, because we've gotten almost no applicants for our open positions, we've increased the starting pay to $11.75 an hour. We feel like with our benefits of no nights and weekends, a lot of people work restaurants, you have to work weekends. That's not true for us. The fact that we try to have staff enrichment activities, go hiking and things like that, and that staff get free lunch when they work for us, it puts us more competitive. And so while there's a lot of talk about raising minimum wage to $15 an hour, we really feel like at this point, the $11.75 is actually a really great rate in comparison to other jobs that are in town. So what we're looking at is basically any time that a part-time employee, so we have 2 that are still with us, one of them worked for basically the entire pandemic with us. Anytime his pay was less than $11.75 per hour, I found the difference, how many hours he worked at that difference, and that's the amount that I've put into the proposal, is the retroactive portion, and then also this fiscal year until the end of the fiscal year. Our view is that this really helps us, it really helps them, and that we as an organization should be able to sustain the $11.75 an hour, especially with the benefit of the funds from this act.
Thanks, Ted. Appreciate it. Any other questions for Ted? Mr. Richardson, anything?
Yeah, let's see. The one question I was going to ask you is a follow-up to Commissioner Ibera's, and that is other places that volunteers come from. I haven't really researched. I know that the soup kitchen gets lots of its volunteers because they get, I don't know, in trouble with the law in some mild ways, and they get community service, and the soup kitchen is one of the places that they go to help. And I guess I'm asking for a little bit of background information on whether the courts are still, handing out community service, and how that affects or the lack of the courts handing out community service, what that does to the soup kitchen.
Is that a question for me, or is there someone there in the court?
No, that's the question. The question is for you, Ted, because you're on the receiving end of that.
Okay, yes. So I think it was really difficult in the first 8 months or so of the pandemic because the Department of Probation and Parole was calling me every month in hopes that we would be accepting volunteers. Since then, now that we do have volunteer positions available, I think on some level, it's the hurdle of getting a person involved. Before, they could just walk in. And I think that in a lot of ways that was free of barriers. But now that we have a sign-up system, especially with quarter volunteers, I think it takes a little bit more effort on their part to get signed up. And that's a hurdle that some of them are struggling with. We are open to them. I'm not sure if we've actually had many since we've reopened volunteer opportunities, and that was in July. We have found that there's more older populations volunteering. So we try to provide a very safe space. We still require masks of all our staff. And I think that they find that to be a safe place, and they're volunteering, which is really exciting. So actually our average age of volunteers has actually increased since we've reopened volunteer opportunities. So I hope that kind of answers it.
Does.
Any other questions, Ted? Thank you, Ted. Appreciate it.
Wonderful. Thank you so much.
You bet. Next up, Climb Wyoming. Did I see Tess or somebody for Climb?
Yes,
Tess,
hello. Hi, good morning. How are you?
Well, how are you? Go ahead. Would you give us a little bit
Good.
more on your proposal?
Yeah, really quick, my name's Tess and I am the Assistant Program Director for Climb here in Laramie, and just want to speak that I can name a lot of program questions, and Bonnie Self will be here closer to 10 to answer some more funding questions. So just naming that ahead of time. Yeah, we just wanted to bring this information here. COVID impacted single moms hugely in the last 18 months or so. And just thinking about moms going to work, and then if a child care facility closes, it's really hard for her to be able to find backup childcare. So just naming that when they don't have that other support system. So we are really, three main points here are getting us more involved in some of the online shifting for Climb. So we have undergone as staff mental health training for being able to do that in a Zoom world. We've been able to connect with some trainers for staff around substance abuse and just ongoing support throughout the pandemic over Zoom. It's been quite a struggle, but we're doing it and we're moving forward. The second thing I would point to is just keeping the jobs that we're training in the programs relevant to the community. We're really capitalizing on the needs of the community. And so, you know, whether that's healthcare or transportation, we're really transitioning our programs to be able to do that. And the third thing I would point to is just connecting with community resources. Everyone on this call is so critical to this community, and we are constantly connecting moms to rental assistance, food stamps, childcare, things like that, to be able to help them get through program, and hopefully without duplicating the services, so that we can rely on our community partners and then use that as referral as well. So that's kind of a rundown. Any questions?
Any questions? Tess, could you cover the second part there? It was like a retraining or a rehiring, or what? I didn't quite get that.
On the mental health part,
yes.
the retraining. So staff, we've undergone a lot of training as staff for mental health support, how we can transition that human connection onto the Zoom world, which is really hard, but we've undergone training as staff as our last in Laramie. Our last two programs have been on Zoom, and then this current one has been a hybrid as we're navigating COVID. So that's one of the retrainings that we've done as a mental health organization, just really staying focused on that. And then with the substance abuse spike in COVID, we've undergone training with that as well to be able to figure out how we can support the women that we might be working with that may have struggled with that in the past.
So do you know if this is staff? Is this staff?
Say that again, I'm sorry.
So
yes, staff undergoes those training.
Yeah, so you're asking this 30,000, is that for staff or equipment or both?
Both, I would assume. And I think that would be a good question to lean to Bonnie as well.
Okay. Any other questions? Awesome. Thank you, Tess. I appreciate it.
Thank you.
Tim, I noticed you just walked in. You probably got a busy morning. Could you come and talk to us about your requests for your projects, please?
You bet. Thanks for your patience, and it has been a rushed morning here. So, Laramie Convention Center, we have two proposals on the table. The first one is what we're calling the Laramie Accessible Mobility Project. And it is intent to continue to extend and grow the free lifestyle and medical transportation that we offer at this time. The need has just been incredible to see, overwhelmingly the growth, primarily as we have tried to stay as intentional as we can to be volunteer driven, leveraging volunteers to help make these particular rides happen locally. Most of the rides have continued to be for medical appointments, people that have ongoing needs and also new needs as a result of limited mobility and medical needs as a result of COVID. And then just continued with economic situations, decline, things like that, not having accessibility to transportation. We know the transportation that we do have in town. We recognize the benefit it does provide with the other organizations, also some of their limitations. And so where we are now, in order to continue with the services and also to deal with the increase, we're at a spot now we probably do need to consider the hiring of a couple more drivers, still leveraging volunteers when we can. The greatest need has actually come from the out of town needs that come up so much. We do offer from Cheyenne to Loveland and to Fort Collins for medical transportation. And within that, so much of the services that we feel like we're able to provide are done through great collaboration with other organizations in town that may or may not have the ability to provide transportation. But definitely we have found a great collaboration. And I think several of those are even represented here in the meeting. I know the hospital continues to be one that we have a lot of need coming out of, discharge, people that have no family in town, things like that, need to get out of town or closer by. So part of our request would be in staffing and some operations, but also be increase in vehicles and eventually even the need for some level of a transportation hub. We're very fortunate to have great relationships with a couple of organizations in town that let us keep the vehicles on their property, but wear and tear and maintenance and things like that is growing. And so we're looking to try and increase that capacity to be a little bit more self-sufficient as far as that goes. That's kind of the quick note there. Any questions you have on that one? Then we do have a second request as well.
I have one question too.
Yes,
Do you try to coordinate rides so that if you have a few clients who happen to have appointments at the same time on the same date, you're that well coordinated?
We do. Yeah. So through our website and then through the collaboration with organizations, we use, let's say, Live Health, for example. They may have multiple clients that need to get to appointments, maybe down to Fort Collins. And when they start making those requests come through our reservation portal. Our support staff or myself will try and reach back out and say, okay, we've got a Tuesday one, a Wednesday one, a Thursday one this week. Any way we can try and put those together, or any way we can do a Cheyenne one on the way, or things like that. Yeah, we have to get that creative if we can. One of our things that we have to cut in our growing pains, we don't require necessarily a 24 or 48-hour notice for requests. Doesn't mean we're going to be completely available, but we don't have that limitation for the request. And so sometimes those things will come in and we aren't able to get as creative, but we do have the ability to meet the needs still, or that's the education process to say, okay, this next time around, let's try and be a little more proactive. And here's how we can look at the schedule moving forward. We do have some rides over that way. So.
And what do you do on the other end when they need to cancel? Is there a requirement for a 24-hour?
We try to, but especially with at that point, the cancellations usually come from the individual, maybe more than the organization, and so contact with them or weather, things like that might cancel. But yeah, we don't require it obviously because we're not charging for the rides, and so there's not any way we can necessarily penalize that or anything, So We just try to have as good a communication. Our support staff does a follow-up call every Monday, for the week coming up and the next week following, especially if they're out of town life.
Okay, and how much communication is out there for those who are not English-speaking clients? Is there a means of letting those people know that there's this service available?
We're getting there. We have a couple of key volunteers that are bilingual, and then we try and leverage any bilingual staff within some of our partners, that might be on staff with case management background or things like that. Internally, we don't have anybody that's bilingual, but so far, when those needs have come around, there's been some way at least to kind of make it happen, as best we can. But that's a great question and a great way to move forward. So,
thank you.
Yeah.
Is there anything?
Oh, I think it's funny. It's called Laramie Connections for a reason, right?
Yeah.
But I suppose the point is that I visited with Tim one time and I asked him what the concept was. And, you don't have to have your own in-house expertise on everything because you're the bridge connector between all, if you can.
Well, we have had this, we are not Laramie Corrections Center, which we've gotten that a couple times. And we're not a dating service either. We've got that a couple times. But I guess if there's a need, I guess we would.
I just assessed from your personality that you meet the person who's standing in front of you and you figure out where the resources are and help them get it.
Yeah, we're trying to lead volunteers to think that way. We try and train them to listen to what's being said that may not be intended to be said, but expose needs. And through that way, we just really value collaboration. There's no need to recreate the wheel. And so that's kind of where we're at on this particular one. So.
Any other questions? Tim, how about the second one, please?
Yeah, the second one's a little beefier, a little loftier. It's a pretty exciting one though. We're calling it the Mobile Home Park Resource Centers. And to put that plainly, in the same spirit of collaboration that Eva mentioned, we have a vision to plant a resource center, whether that's through purchasing or renting a mobile home unit in each of the 26 mobile home parks in Laramie. Obviously, this initial would be a pilot program, starting off with maybe the 2 or 3 that we have the most current busy activity with. I'll use Sunny Meadows as our primary example, which is over off of McHugh and also by the Timbers. We probably have a dozen to 15 friends that we already provide some services for, mainly transportation and meal delivery over there through the collaboration, and have definitely seen the need and have begun the process of beta testing the idea that if there was an actual unit in the park, not necessarily the community center that has the pool and things like that, but an actual resource center that could be a space that our community services could have a presence at as well in that mobile home park. The idea would be that we would either employ or hire or find a volunteer that would actually live in the unit in one of the rooms, and the other rooms be used, for examples, as computer lab, resource room, teaching kitchen, safe place, safe playground, dedicated vehicle to that mobile home park, and have resources come in. So it could be a place that case management could come to the place rather than the individual struggling to find transportation to maybe a case management employee or an ERAP appointment, or even some of the healthcare to some degree. And so it's a beefy attempt, but we've seen the need over and over and over that perhaps we could even limit the resources being used on getting people to other places by having that place on site. We have begun working with a couple of property management companies that have the mobile homes available for rent that we would pursue to try and get this off the ground. It comes alongside also the great needs of maybe even like a day center for youth, after school kind of things, but that would have staffing there. That would be a place also for refuge, even in evening times or in bad weather. When we've talked over the years with Interfaith about like a satellite food pantry, even on location, some more immediate needs, so things like that. I'm sure there's a lot of questions on that one. There's so much to possibly go in on that in the presentation you see, or in the notes you see that, we talked about Interfaith, DFS, ERAP, the school district, home health care, and et cetera, and trying to be able to provide services that are more localized than having to be dependent for the people to go to them, having that as a resource place. So
And Tim, in the long run, how would this sustain itself?
I think it would continue to be sustainable through grants, private donations, a lot like how we're already organized. I think there would be a great benefit in the long run for the partnering organizations to maybe see it as a benefit to come alongside and some creative fundraising. But I think the whole concept fits within any number of the community and federal grants that we've already been a part of and seen, much like this one.
Sure, it's a pretty cool idea, yeah. Yeah, I don't know. I don't know if, but I think it's nonetheless, whether it's funded or not funded, I think it's a pretty cool idea. And,
we're gonna give it a shot.
Yeah, and I think it does fit within the ARPA tenets of feeding those underserved folks. And so I don't know what will happen, but don't let this body, if we can't fund it, tell you that that's a bad idea, because I think it's kind of a cool idea. So maybe there's a different way of going about it. But yeah, thank you. I like that thought. So,
All right.
Anything else?
Thank you guys for the time.
Jessica, looks like good morning.
Good morning.
Could you give us a little bit more about your program for hospice? Thank you.
Apologize for being late this morning. I was seeing patients, so that'll fit right into my what I'm about to talk about here. So we requested $75,000 to help offset staffing costs. This could be a one-time or over a period of time. And the reason that we're making this request, as you know, hospice care in-home is free. Hospice care in our facility does come with costs. We have to keep the lights on and things like that. And what we found through the pandemic is that more and more folks are having trouble making that inpatient cost. And there's also a much greater need. Sometimes their caregiver is working a second job and is just not able to be home to care for them. So we have found this year we're providing more charity care. You know, hospice has been in this situation before where charity care became an issue. I'm happy to say that that is not an issue now as far as sustainability. This isn't something we need to keep our organization floating. It would just allow us to provide more of that charity care to families that I think are really impacted by it. As far as being appropriate for the grant, I think this falls under section 603B to respond to workers performing essential work during the COVID-19 public health emergency. And just a little bit about staffing in the medical field right now. It's horrible. Very difficult to find clinical staff, and the pay is so competitive. So this money would allow us to be, competitive with places like the hospital, like Premier Bone and Joint, and just to be able to give our nurses and CNAs that are really, really on the front line. We're taking care of COVID patients in the last days of their life, to be able to pay them appropriately and still provide that charity care. I'm happy to take any questions, and again, thank you guys for entertaining us.
Commissioners, any questions?
Good. Okay. Well, I hadn't formulated it yet. I got some stuff going in here, so if you have one at the tip of your tongue.
That's what I do. How many people would this premium pay cover, Jessica? Do you have an idea?
So we have about 28 clinical staff, and this would be able to cover raises for 1 year. I hope that at the end of that year, we're in a little bit different situation as a community where we're not needing to provide as much charity care. And if we do, if we're able to stretch that out a little bit further, this would just help us really appreciate those staff that are performing that work for at least a year.
Thank you.
Mr. Chairman, my question is, why is it so hard to come by clinical staff? What is happening in the medical world these days that's making that so challenging?
I think there's a lot of things. I think when the pandemic started, there were a huge section of healthcare staff that said, okay, I'm gonna stick this out for a while, but I was pretty close to retirement and I'm gonna go ahead and retire. Healthcare is very difficult to provide care in this environment. Nursing schools are doing the very best that they can to provide good clinical experience, but healthcare workers are just so in demand. We're not able to hire so many new grads. And I know that a lot of places are going to lose employees due to the vaccine mandate, so it's just getting a little bit tougher, a little bit tighter.
Any other questions, Jessica? Jessica, thank you so much. Appreciate it.
Thank you so much.
All right, anybody from Cathedral Home join us yet? Just don't want to miss you. All right. Josh, the Laramie Interfaith, could you talk to us about, I think you have 2 projects for us. Floor is yours, Josh.
Good morning. Can you guys hear me?
Gotcha.
All right. Yeah, we have, I put in 2 requests. And I guess I'll start with the bigger one here first. We've got Cole Nutter with Family Promise. And what we've kind of pitched here, kind of piggybacking off of Tim with Laramie Connections presentation, is a resource and infrastructure center for housing insecurity. Because of COVID and simply because of other issues, you know, we have a lot of housing insecurity in our community. Inflation, shrinking housing market, a lack of actual affordable housing. I know that the city's been addressing this and has some conversations with the county. This is just an ongoing issue, and one that we thought we'd try to take advantage of, you know, this ARPA funding and get ahead of a little bit. This center is a place for people experiencing housing insecurity and other poverty-related issues to come together. A place for nonprofits to collaborate where, you know, we're not sending people kind of, you know, hiking around town. If my organization thinks that a client might be a better fit for Family Promises program, for Salvation Army, it's a lot easier for us to work together. I think we work great together, but it's a lot easier to work together when they're right across the hall, not across town. The idea for this place goes beyond that. You know, as Tim kind of already said, this is a place for other nonprofits to come in and do their work. So, you know, a place where Tim could bring a bunch of people in one trip or pick a bunch of people up. A place where we can do community presentations and get in front of our demographic and give them more information about the issues that are affecting them. A place where they can come in and have internet access beyond just a library, where they're limited to an hour if they're trying to get through a job search and do these online applications now that take, I mean, some of them are hours if you're not, you know, a supercomputer user here. And it allows us really to address all of the areas of our clients' needs. Cole, you want to add in?
Yeah. So I didn't submit a proposal because this is kind of our priority as well. I intentionally wanted to jump on board with Josh at Interfaith, and we've talked to a few other partner agencies in collaborating on this. I think one thing that wasn't emphasized as well or as much is that we are at this point, basically Josh, Salvation Army, and I are the, we work with families experiencing homelessness. We're the only groups in town who do it. And in the future, and well, currently and in the future, we anticipate running into issues with having places where folks can stay. We rely on hotels. Hotels are not all, they change their prices. Sometimes they decide they don't want to take families just because they've got potential tourists coming through town. It depends on the time of year. We need a sustainable infrastructure for this. We need it. Otherwise, we're going to have families with nowhere to go and they're going to be on the streets. That's not going to be good. This facility could also provide just a small number of units for that as well. So basically, it's not just a place where families can stay. It's not just a place where mental health services could be accessed. It's where people could collaborate. It's something we need in this town, and we're 100% going to need down the road. And so we have an opportunity now to fund it. it would be a shame if something like this wasn't put through.
And I think that's, one of the transitional housing that's included with this, those handful of units. The importance of this is, kind of critical as we're looking at about moving our clients and households around town. If there's one single person in a household and the only apartments that we can find are a 3-bedroom, it's not a sustainable solution for them. That's not a good solution for us and the grants that we work with. Trying to find an appropriate sized home for some of our households. This is a months-long process right now. This is a struggle in our community. And so we're relying on these hotels, like Cole said, through changing ownership, though. One of the motels that Interfaith worked with this summer, we lost the opportunity to work with them. They were pretty upfront and matter of fact about it. We had a lot of construction people coming in to work on windmills. They were making a lot more money off of them than they were on the negotiated rates that we had. I can't fault them for that, but that really reduces the resources and the options that we have to keep members of our community from going homeless.
Commissioners, any questions for Josh and Cole?
Yeah, I do. Josh, traditionally, how long are you having to house someone in this transitional housing space?
Depends on the time of year. Right now, we're looking at probably 2 or 3 months. It really kind of depends on when people move out, and we know that works in cycles with the university. So as December comes up, people graduate. I think it'll get a little easier as they all move back in here in late January. February through April is going to be another problem spot. Then they'll start leaving in May. So we're not talking about a permanent place for these people, but it's those transitional times where they're in between. Some of the rents we've seen around town have gone up by 30 or 40%, and we have to do a lot of work to try and get them into a place that's going to be sustainable for their situation.
Thank you, Josh. One other question. What is our housing insecurity number, if you could say, right now? What have we seen in the last year, especially through the pandemic and all?
That's a hard number to get to. Right now, we're only taking appointments simply due to limited capacity. And we've done over, I think, 550 households this year. This number is in excess of the 365, I believe it was, or 364 that we did in 2020. So we've increased our capacity, and as we've increased our capacity, we're still running into a roadblock where we just don't have the staff available, the times available, the space available to continue to help people. We've done a great job, I think, this year of leveraging, the state's ERAP program, a lot of the other federal dollars related to COVID and CARES and those different acts. Next year, we're already planning for the loss of those funds. Obviously, those were one-time things. So our numbers will go down, and we're just looking for ways to address that. But we're not meeting the need right now. So as many people as I can serve, I'm not meeting the need.
I want to emphasize that ERAP funds, we're a much smaller organization. I think in the last year, we've worked with 96 groups, whether families or individuals. There was 56 families experiencing homelessness that are indicated through the McKinney-Vento numbers through the school district. We've worked with, I think, something around 104 individuals, just families experiencing homelessness. But with that ERAP, Josh and I have collaborated pretty closely on ERAP for the last year, and we've been relatively successful in doing so. And I think that sort of collaboration is what we are looking for with this project.
Thank you, gentlemen.
To add a little bit more to that.
How many rooms do you guys contract a night? Do you have an idea, an average amount of hotel rooms you go through a night?
So we have a monthly contract for 3 rooms. In addition to that, depending on the need, we'll usually contract another 3 to 4 right now.
And with this, how many would you suspect units would be in there? 6, 10? What's your thoughts?
I'll be honest, in the past 2 weeks, we haven't really gotten, a specific number, but yeah, it'd be somewhere around a 6 to 10. Not a whole lot, but, somewhere that would give us the flexibility to do that.
And then the staffing part of this, would that comes from you guys' organizations, or how do you envision that piece?
I think that would come from us. We have, in the past, I guess, 2 years now, if we go back to 2019, Interfaith has gone from 3 full-time employees. Right now, I have a staff of 11 paid employees. So I think we have the staff here working the programs, doing things. Most of these are all sustainable positions. A couple of them are contract positions with the ERAP program, but I think we have that ability. It's just the housing that's the issue.
Super, thank you. Any other questions? How about your second project, Josh? And maybe Cole's in on that too, I don't know.
The second one was, I realized our first one was sort of a big pie in the sky kind of dream here. But we wanted to get that in front of you all. The first one here is just a little bit more practical. What we're asking for is simply money to add into our current project here, expanding our pantry. The pantry expansion was started through a community development block grant with the city back in 2019 or 2018 is when they started the work. 2019 it was awarded. The initial estimates on that project planned for the grant to cover about 90% of this project, with Laramie Interfaith being responsible for a match. Post-COVID construction costs, we've seen construction just skyrocket. Our building went from about 490 estimated to a little bit over 700,000 this year on our final bid with the city. So, we're committed to moving forward with this and finding creative ways to solve that problem. This would just be a component to help with that.
Commissioners, any questions?
I just have one comment. It's good to see you, Cole. Cole and I go way back.
Josh, Cole, thank you so much.
Hi, Hebert. Sorry. Hi, I'm here.
Cyber Wyoming Alliance. Is anybody here for Cyber Wyoming Alliance?
Yes, Mr. Chairman, Board of Commissioners, thank you so much for having us here today. My name is Pat Wolfenbarger. I'm a co-founder for Cyber Wyoming, and here to talk to you about our proposal to help all of the nonprofits in the county enhance their cybersecurity. It's something we were approached about doing, and by some individual nonprofits, but in a discussion, we all agreed it'd be great to be able to provide that kind of training and long-term support to reduce their cybersecurity risks. We think the ARPA funds specifically are designed for this kind of project because the attacks on nonprofits, as well as every other aspect of our society, have been increased due to the COVID as people move to work more offline, as businesses have to work with enhancing their security with their employees as they work offline. Nonprofits have databases that are sensitive with a lot of donor information, membership information. So they're kind of popular, but yet they don't have the resources to really deal in depth with things. So we hope to provide the trainings to get them to understand how much they can do without having to pay money for it, and then provide the kind of expertise that they need. So when they are working with managed services or IT companies, they know the kind of questions to ask, not only about services, but about hardware. Ultimately, what we hope to do is provide a support group among all the nonprofits that can provide, training the trainer experience that will continue long after the initial training that we're proposing to do. And we hope that this can be a model for taking it statewide to other communities and to do. We have a program similar to this already in place in Cheyenne with the Chamber of Commerce that's been working, and we're developing concepts for municipalities and counties as well for this approach, where the resources aren't great for communities to be preventive in their cybersecurity approach. And really in the state of Wyoming, there isn't any preemptive approach to cybersecurity. It's all reactive, and that's where Wyoming comes in. We're providing that kind of proactive approach. And I'll answer questions. I just want to say, we've worked with a lot of the nonprofits that have been here before you today, and they can speak as to the efficacy of what we've been doing with them. So we're hoping that the county can take this and provide that kind of a basic support, so we can help our local nonprofits really enhance their cyber risk management.
Thanks, Patrick. Commissioners, any questions?
That was my only question, Mr. Wolfenbarger. If you are actually servicing these nonprofits already.
Could you repeat?
Oh, that was my only question, and you actually answered at the end that you are providing services currently to some of the nonprofits in Albany County.
Yes, we've worked with several of them. In fact, in our cybersecurity competition that we do every year, last year, the Laramie Depot finished in second place. They're a nonprofit, and we've had others enter. Primarily, our basic targets are small businesses, professionals, nonprofits, and small government units that don't have the resources to really do the kind of analysis, and we take them hands-on and provide the training and the knowledge they need to take those first steps. A lot of times it's because they're, cybersecurity is scary, and try to break down those barriers so they can actually be empowered to deal with the challenges they face.
And so, Mr. Wolfenbarger, this would be, the intent would be to reach out to some nonprofits that currently are not using your service?
No, this would be, for everybody beyond, because a lot of times we're just doing specific needs that they may have. This would be to help train their staff, to help not only continue their practices, but to help their clients who may have questions. Some of this, more and more of what we're doing as a community and statewide and nationally is online, and that's really increased cybersecurity risks for everybody, and trying to help enhance, again, that risk management for the clients of these nonprofits. So when they have questions about the services they're receiving online, they have there's expertise in the nonprofits to help them deal with cybersecurity questions they may have related to the services that they provide.
Thank you.
Any other questions, commissioners?
Again,
Thank you for joining us, Patrick.
thank you again. Any nonprofits there, you can ask them who've worked with us, and they can give you some insights about that. Thank you so much.
Thank you. Next up, ARC Regional Services. Anybody here from ARC? Colby,
Hello.
good morning.
Good morning. Start off by thank you guys for this opportunity. I'm Colby Chisholm. I'm the development manager at ARC Regional Services. So today we wanted to start out with our project proposal. We have submitted our project proposal with intent to obtain $50,000 in funding to support a recent wage increase in our direct support professional staff. So as many of you have discussed here today, concerns over hourly wage increases have been identified over our country and in our community. Our organization has specifically identified hourly wage concerns affecting our workforce with direct support professionals. I don't know if you guys are familiar with direct support professionals, specifically their job duties. They are really the backbone to our services that we provide with support of our clientele, specifically hygiene, health, transportation, and education. ARC has experienced a lot of particularly large impacts in loss of employment as a result of COVID and these competitive wage increases in our community. This impact has a potential to affect the services we provide in our community, specifically with the clientele that we support. And these wage increases have been a particularly large problem in funding with challenges to our regional services. A little background behind where we obtain most of our funding. As a human services provider, ARC acquires the majority of its funding from Medicaid. Unlike other businesses or organizations that can control their funding to some degree, ARC's funding is restricted by fixed rates that are determined by the state of Wyoming and Medicaid. So in an attempt to retain staff and to avoid ejection of clients from our services, ARC has decided to increase the rate of pay for direct support professionals to $14 an hour from $12 an hour. And this is as of November 1st this year. So this increase has been budgeted to sustain within our organization for the next year, but will require financial support to endure after. This spring, we do expect Medicaid to increase rates for human service providers, but that increased rate amount is still unknown, and we do not know how this would support our funding for employment. So that is why we have proposed this specific project. And I can take any questions that you may have.
Commissioners, any questions?
Let me see if I understood, Colby. You're asking for $50,000 to help with the wage increase for your direct support, and it would help for the. See, you have what you need for this year. It would be for 2022, but then it's not necessarily sustained with Medicaid beyond that.
Yes, ma'am. Yep. So we don't necessarily know what this increase is going to be and how it's going to affect our funding. This recent wage increase was to address the emergency within the loss of workforce that we've been experiencing. Without that workforce, we cannot provide the quality services that we typically provide for our clients. And in some cases, this could mean the ejection of some of our clients as we don't have the staffing necessarily to support them.
Okay, so then in 2023, if you don't get the funding that you want for Medicaid, what happens to this increase for these employees?
So this increase will stay, but like I said, this would have the potential to start ejecting clients from our services. Along with that employment, we would not be able to employ as many people with this increase as well. So that therein also will affect the services we provide.
Thank you, Cody.
Yeah, thank you.
Did you want to say anything? Colby, thank you for your time this morning.
Yeah,
Appreciate
thank you too. Yep.
Next up, Albany County Safe Project. I thought I saw Farron. Farron, good morning.
Hi, everyone. Thank you guys for taking the time to listen to all of us today. So SAFE has kind of asked for a smorgasbord of things from the county. And I have an additional request as well, but I'll just start with what our letter of intent had outlined. So I requested $25,000 from the county to help us with shelter-related expenses at SAFE. Currently, we are badly in need of new furniture for the shelter and increased storage for the shelter. Can you guys hear me okay?
Yes. Yeah.
Okay, great.
Yep.
So we are seeing a lot of clients. Safe Project is busier now than we've ever been, even during the pandemic. In October of 2021, we worked with 76 people. In October of 2019, we worked with 52 people. And the reason I go back to 2019 is because 2020 was kind of a wash for us because of the pandemic. Everything in victim services was just weird in 2020, even for law enforcement. We were all really quiet with domestic violence and sexual assault. So I've been comparing a lot of our numbers to pre-COVID numbers. We are sheltering more people than ever. Our clients are staying in shelter longer because they are having a hard time securing sustainable, affordable housing and sustainable employment due to the pandemic. A lot of our clients, I mean, as you guys know, most of our clients live in poverty. A lot of them don't have access to good medical care. And so they have been faced with losing wages, losing their jobs because of COVID, and because their children have gotten COVID as well. So we're in a really tight spot, and unrestricted funding has decreased for us pretty significantly over the last 2 years. Typically, we're able to host a really large fundraiser every year called the Brunch and Bubbly. Usually we profit nearly $20,000 from the Brunch and Bubbly, but obviously it's not responsible to pack 200 people into the Alice Hardy Stevens Center during a pandemic. So we haven't done the Brunch and Bubbly in the last couple of years, and unrestricted funding has decreased, as well as federal Victim of Crime Act, VAWA, and VIPSA funding. So we are badly in need of financial support at SAFE. The increased storage would be to add on to our storage unit outside of our office. Currently, we have some storage units on site that we can use for extra in-kind donations, groundskeeping equipment, things like that. But we really need additional storage for our clients because we're finding more and more that clients are coming to shelter with quite a bit of belongings. They're not leaving their belongings behind, and we don't have a lot of space for them within the shelter. So we would like to build a small, but reasonably sized storage shed outside of our office to house additional storage items for our clients. And that's something that we've asked for with federal funding, but they consider it a capital improvement item, and so they won't fund it. So it's not been something we've been able to make possible, but it's definitely a goal that we have. And then I was really conservative with my request because I wanted to be really conservative, but since submitting my request, I have become more and more concerned about unrestricted funding for my staff, and salary funds are, not an exciting item right? But in order to do human services work, you have to be able to pay people to do the work. And my staff is badly in need of additional salary funding. So I'd like to request additional funding to fill in that gap with that unrestricted funding that we have lost because of the pandemic. Our monetary donations have also been a little bit lower because of the economy. I think people are struggling more and are donating a little bit less. And so I'm not looking to increase salaries. I don't want to do anything that would not be sustainable, but I do think that if the county can fill that gap until we can host a fundraiser, and until, we're hosting fundraisers, but until we can host that big brunch and bubbly fundraiser, and until the economy picks up and we start seeing more monetary donations from the community, I think that gap could be filled by the county, and that would be a sustainable thing for Safe Project. So I'm not looking to increase salaries or anything that wouldn't be sustainable. So like I said, it's kind of a buffet of different funding items, but that's my request in a nutshell. And I'm happy to answer questions for you guys.
Sure.
Karen, did you give us the number for that salary funding?
No, but I'd like to request 20,000.
Thank you.
You're welcome.
Mr. Richardson, anything?
Well, so the 20,000 request, is that in addition to or included in the lower?
It's in addition to Commissioner Richardson. It's, yeah.
Perfect.
Yeah.
Thanks. Other questions? Karen, thank you so much. Appreciate
Thanks,
it.
guys.
Let's get the next one. I'll be here all day, so I can pick that one up while everybody goes to work. Larry Foster Closet. Anybody here from the Foster Closet?
I am.
Hi, Jenny. Good morning. The floor is yours.
Hey,
Can you
how
tell
are
us a little
ya?
bit about it? Well, thanks.
Good. Yeah, I can totally tell you a little bit. We started a new project at the end of June, at the end of school last year, and launched it at the end of August this year. And it's called Cody's Closet. So Cody's Closet, we were supposed to start it as a pilot project, and it kind of just took off because of COVID-19 and all the needs that kids are having. And so we widened our focus from just helping children in foster care to helping kids from hard places that are in Albany County. And so what we have found through research is that Cody's Closet actually improves school attendance and graduation rates. It also improves mental, emotional, and physical health of students facing poverty, homelessness, and other crises by providing free in-school access to gently used, like new clothing that's donated by the community, and basic necessities. And we unite with community partners to meet students' immediate needs. So a lot of times kids here are coming to school without the correct shoes, or they need outerwear, or there's holes in their socks. And so what Cody's Closet does is we make sure that we meet the student needs right there in this school, and then indirectly through our agency by offering a source of instant relief and empowering them to focus on thriving in their current environment. So we basically expanded our focus because we had excess in the closet, and we were able to meet more needs than we have in the past. So when school started this year, we originally wanted to do a soft opening, and it was just going to be at Linford Elementary. But word kind of got out. And so we now serve 8, I think, out of the 12 schools. And we are hoping to start serving Whiting, Vital, and Indian Paintbrush. The schools that we're currently in are Spring Creek Elementary, Linford, Slade, the middle school, the high school, Montessori, Head Start, and the lab school. We've served more than 100 kids since the beginning of school this year. And this can provide financial alleviation to parents, because parents usually spend up to $1,300 per kid per year, or 6% overall. So $24,000 is the least amount that somebody spends from 0 to 18, which is a pretty hefty sum. So by reusing community donated goods and enhancing our infrastructure, we're going to be able to serve even more kids and get to all the schools here in Albany County. Basically how it works is we work with every social worker and nurse in the schools, and we stock their nurses station with extra clothing. We put about $8,000 in at the beginning of the year, and it's already gone. But that is because we've reached so many needs. We have kids that are going and getting socks and underwear at school and having their needs met. And then after they have their immediate needs met, if they need 7 days worth of clothing, then we deliver it discreetly in a duffel bag with a new package of socks, underwear, and a new pair of shoes. We've partnered with a ton of people in the community, and we've partnered with a ton of entities. We just got we're getting a shipment of 500 pairs of shoes from New Balance, and we'll be paying $7 per pair instead of the $60 to $80 per pair they would be normally. We are looking to spend money this year to up our infrastructure. We need more bins and more shelving. And then I am in a master's degree program, and so I will graduate in June, and my hope is to get a part-time director for this program so I can focus more on fundraising and that type of thing instead of running the day-to-day operations. We work with AmeriCorps, and we're hoping to get a Vista, so that would be $2,000 of this funding for the Vista. And we're also looking for some salary money, about $20,000 for a part-time director. We have another $20,000 so we can make it a full-time director position. It would be part-time serving foster families and part-time serving Cody's Closet. We've worked with a ton of volunteers this year. I think we're over 600, and we've done it all safely, and we've had social distancing. So really this is for building infrastructure and making sure that every kid in the school district is served and uplifted, and that they can engage in learning and growing.
Thanks, Jenny. Commissioners, any questions?
Yeah, so Jenny, do you get some of your donations from individuals in the community, but as well as any of the consignment stores give you donations as far as clothing?
Yes, absolutely. So we also have donated items from New to You. We work quite closely with the Harders. It seems that, I think I've been singing this song for years now, but it's socks and underwear and pajamas and, the basics that end up costing our community so much. And it's amazing. You can go out just for 7 pairs of PJs and come back with, you spent $100 easily for one kid. And so, I think this provides financial alleviation in a way that is really meaningful for parents, but also for children.
Thank you, Jenny.
Richard, anything? Jenny, would this be, the 60,000 be split amongst supplies and also staffing costs, or could you talk to me?
It would be $20,000 would go for a staffing cost, and that we will be able to replenish because I will be able to work more on fundraising, and it is sustainable. The other $40,000, it would be $20,000 for equipment and infrastructure to build up to the capacity that we need to be at. We currently just don't have enough space we have enough space. We just don't have the amount of storage bins and shelving we need to organize things correctly. And then the last $20,000 would be for, this year getting through, I think for all of 2022, we planned around $20,000 for shoes, socks, and underwear. And we're working with people who are giving them to us at extremely low costs so that we can serve all the schools here. And yeah, we're mostly run by volunteers, but once we have somebody on staff, we can also have an AmeriCorps Vista, which can help us with capacity building and everything else. So.
Thank you, Jenny. If there's anything before we go. Jenny, thank you for your morning and your presentation. Next up, Greater Wyoming Big Brothers Big Sisters. Anna, Steve, good morning.
Good morning.
Thank you guys for your time today. We sure appreciate your support. Our project, as proposed, as you all are familiar with, my brothers and sisters, we work to strengthen kids and families and thereby strengthen the community through those efforts. We were expecting an increase in the demand for services with the pandemic. We knew that kids were not necessarily having their social-emotional needs met first and foremost throughout the pandemic. And that lack of stability was going to kind of snowball and cause some increased needs and some increased issues and concerns. So we were anticipating an increase in requests for services. What we've been finding over the last few months is that we are getting a lot of families who kind of don't know where to turn. They don't know where to go. They're looking for services that are outside of the traditional scope of the school district and DFS. They're kind of falling somewhere in the middle, and they're looking for those resources to try to get over the hump, get back on track, get things back to where they should be, but they're just not sure where to turn. So we are proposing with this project to hire contractually some social workers for the next couple of years to help coordinate those services. We know that those services are out there, and we're happy to be able to collaborate with our community partners and things like that. We just are looking for somebody to kind of help with that care coordination, to develop a plan for the families based on their individual needs, and then be able to kind of guide them to where those resources are, make a plan for success, establish some benchmarks and guidelines, things like that. That is kind of the nitty-gritty short piece of it. It would be temporary. We believe that the next couple of years should be enough to kind of get back to basics and kind of have people on the path and trajectory that they need to be. So it would not be an ongoing project. We're just looking to fill the gap that we're noticing coming directly as a result of the pandemic, and families not quite sure where to turn, services needed that are just not quite in the scope of what is already being provided from other resources and things. Because we have a long-standing established relationship with community partners, we think that we'll be able to facilitate that pretty smoothly and pretty without a whole lot of fuss and bother and startup kinds of concerns. We also have access to families who are in need and in those circles already, who are already kind of the most vulnerable and who have been the most affected by the last couple of years. So that is kind of in a nutshell what we're looking at. Steve, did you have anything to add? Yeah, so I'd be happy to answer any questions.
Commissioners, anything?
Yeah, and have you thought of tapping into UW as far as social work students who could provide this kind of service to you as an internship or something like that? Or has that been exhausted? Are you hoping to get somebody who's a little bit more education and trained in this area, not so much a student who might not be?
That is the hope. We're looking for somebody who kind of has experience with working with various agencies and things like that. We do use interns at Big Brothers Big Sisters, but this is sort of outside of the scope of their traditional roles and how they fill. We also want to make sure that there's a consistency of care with the family, so we're not looking so much for intermittent hours or less structured kinds of opportunities, because we want to be able to assign one family to one person who's going to be their kind of touch point and go-to. So there's a little bit more consistency in that. And we want to make sure that they are highly skilled and trained in kind of that holistic perspective of helping families, that it's a systemic issue. It's not fix one component of a family, and so we need to look at all of the various challenges that they're facing.
And so your 2 years, would that sustain that kind of support for a given family? Let's say you get a family a year into this, and your service is only provided for an additional year or 6 months. How is that going to work out?
the goal would be to set a timeline with each family. So we're kind of setting those goals, looking at those metrics and outcomes and things like that. So it wouldn't be like an ongoing forever kind of relationship, but enough to kind of help them figure out how to access those resources on their own, so that they are able to be self-sustaining and move forward. We also know that this is a pretty significant increase in need as related to the past couple of years. So we're hoping that at the end of the term, we'd be seeing less of those kinds of cases where people are just kind of not sure where to go to access the services that they need.
And so how are you dealing with this right now with these numbers that you're getting, families or individuals coming for that kind of assistance? Are you referring them to other entities that do deal with this stuff, or?
As best we can. We're very lucky to have good relationships with our community partners who are working hard to make sure all sorts of bits and pieces are being filled and that people are getting the support that they need. It's just outside of the general scope of what our case managers usually do. And with the increase in requests for even just those basic services that we always provide, there's not enough capacity to fulfill that in the longer term.
Thank you, Ann.
Tristan? Hi, Anna. I actually have a question in a different area, and that is, it seems like Big Brothers Big Sisters this goes back to when this commission decided to return some of the juvenile specialty court money for lack of participation. And I was trying to figure out if that is for lack of need, or if it was sort of for lack of execution, or maybe if the pandemic had something to do with that. And this might be a question for Steve, and I apologize, it's kind of a heady question. But it seemed like to me at the time that maybe there was still some opportunity to salvage or restructure the work that Big Brothers Big Sisters does for the juvenile, specialty court. I hope it's okay that I asked that question.
I think the root of your question, no one knows. There's lots of jokes about the best way to reduce juvenile crime is to release a pandemic virus, because what we saw is citations for juveniles in trouble cut in half or less, which immediately dropped caseloads, our workloads at diversion. You're seeing that in drug court. And now we're starting to see it creep back up. Everyone's trying to predict what that means and why that happened. A lot of folks suspect that we'll see increases in drug use, some of those things slowly over time, but no one really knows. With the cuts to the VOA grants, the juvenile services, it's worked out because the caseloads have kept pace with the lack of funding. We can't predict what's going to happen. We are seeing it creep back up. That's a lot of our proposal here is the referrals we're getting aren't really for crime and citations, but we're seeing higher risks. We're seeing a lot more phone calls for kids that aren't going to school or really struggling with mental health issues, those types of things.
Sure.
What we're hoping we can do is get ahead of that before it manifests as being more serious problems as these kids grow into adults and are speaking.
Yeah, I guess my question, I was trying to, because at the time it seemed like the thing to do, and then I had more time to think about it, and I haven't discussed it with the other commissioners. So, but the idea, I guess, is, I'm sort of wondering if what we were seeing was temporary, and if we maybe acted too soon, or if we would do well to take another look at that. And I think what you just told me is that we don't know. We don't know what's going to happen. It's probably hard to hang on to programmatic funding when you can't meet the numbers, regardless of the reason why, even if it's temporary, right?
I like to hold on to hope that it's because of the work we've all done for 3 decades in our community, and we're raising our kids well and healthy.
It would be good to work ourselves out of a job in that case.
Also, just as a prevention focused organization, we're trying to help kids and families before they get to that point, before they have a contact with law enforcement or before there's a crisis situation. So that's always our goal. If we have the interventive services for those families who have gotten to that point, but what we're doing and what we're trying to establish with this additional project as well is trying to stop it before it happens and then reach people before it becomes a crisis scenario.
I suppose I'd rather use ARPA funds and fund the prevention than the reaction.
And one quick question, with the social work, would those be available to other entities that might need it? So other nonprofits that might need social work help, they could send them to the Big Brothers Big Sisters and get that help. Is that how you envision this, or is it just for Big Brothers Big Sisters?
That's reasonable. What's interesting is our initial proposal, we proposed it as 2 full-time staff. That's where those numbers came from. Benefit, we wanted high-level, highly trained, highly qualified people. We had conversations with Evelyn Bailey that may not be eligible for these funds. And so the more we talked about it, the more we were discussing going contractual. But the interesting that happened at the same time is we were reaching out to all of our university contacts saying, we need staff, just like every other nonprofit can. And we had several offers from people that said, I'd love to do a few hours on the side. I'd love to pitch in and help out. I'd do an extra 10 hours a week or something like that. And it was enlightening to us because we think those professionals could fit under this contract if we were able to figure out how to do it logistically with the contractual arrangements, and maybe get folks that are already doing this type of work in our community to just do a little bit more with a little bit of this funding. So, it's all kind of a big fuzzy concept, but I think the pieces would come together to help us figure out how to fill these voids that we're seeing.
Thank you guys.
And
Appreciate
so
it.
Steve, are you saying this 100,000 you're requesting would not be that then? If you did go the contractual route?
I think it would end up being the same amount of labor, just converted from employment with benefits to contractual.
Okay.
There is a possibility that you could get better help going the contractual way. If it's not so fragmented in its part-timeness that it can meet the demand in the right hours. But you could do better that way, actually.
Thank you guys. Appreciate it.
Thank you.
Feeding Laramie Valley Action Resources. Gail, I have you up next. Is that who's presenting, or is there somebody else?
Yes, he is here. I'm here. Thank you. And I apologize for not having audio. My very rural location today is not permitting me to use audio. It's not permitting me to use video. So, but thank you, commissioners, very much for sharing this work session with all of us. It's been quite amazing to once again hear all the extraordinary things that people are doing in this community. Feeding Laramie Valley, after 12 years of doing the food security work we've been doing by trying to move toward food security that is sustainable, is actually ready to take a very bold move and go in the direction we've been working for the last 12 years. And our request for ARPA funds reflects that boldness, both in terms of what we're asking for and the project that we're proposing. What we all learned, again, that we've already known, but we learned a really hard lesson all over again from the pandemic, is that food security in a place like Albany County is always at risk. And we saw it happen here. So we saw it as a result of, we saw a lack of access, we saw an increase of cost, and most of that comes from distribution challenges. The supply chain, as we all know, was strongly affected because we're expecting so much of our healthy foods to come from a long distance. And so we believe that it's really time to, and really appropriate to use these ARPA funds to not only help with pandemic recovery, which is in terms of economic development and just recovering from the fall that we had from access to healthy foods, but also to move forward in a realm of creating a locally sustainable food system that is much less, that is more impervious to disasters and emergencies. One thing we know, and we've known this for years, is that having to respond to emergencies is essential. And we have wonderful programs that do that, including Feeding Laramie Valley, but that is not the long-term solution. So we are proposing with our project here is to begin to take that leap, and we're asking for a one-time investment in funding to help us create the infrastructure that will help us move into the next phase that will provide a sustainable food sovereignty for Albany County. We've already taken a number of steps in that direction. We've prepared the foundation for all of this. Feeding Laramie Valley, our volunteer numbers are way up, volunteer hours are way up. We are providing Vista and AmeriCorps members across Albany County, and including utilizing those full-time services for our own work. We have had a base pay rate of $15 an hour for several years now. And we also provide career and leadership development. So whereby we're trying to do internally at Action Resources and Feeding Laramie Valley, but we're also providing to the community. So we're offering great benefits, great pay, and an opportunity for people to also move forward and create sustainable lives here, which will contribute to sustainable economic development, even as we try to help feed people. The loss of access and the increase of cost over the last 2 years, going on 2 years now, has just been mind-boggling for us, as it has for everyone else. We're up to providing 85 delivery sites every week for fresh produce. We're providing pickup for over 500 people every week for fresh produce. And we are serving over 1,000 meals during the summer, and then weekend meals we provided throughout the year during the peak of the pandemic. And so those numbers, as I said, are mind-boggling to us. And of course, the cost associated with that goes along with it. When we look at sustainability, in addition to our own food production and distribution, which is great, that helps, that goes a long way. We've taught a lot of people how to garden. They're in turn contributing food to us and sharing with their neighbors who need it. But we need to be able to actually create a system that will support our local agricultural producers, including the small gardener and the small homesteader, which will, again, advance our economic development. So what we've done is we've gotten together, we've started a new partnership, well, an increased partnership with one of the largest ranchers in the county and one of our largest, most successful farmers in terms of creating produce, and have partnered up with Ivanson Memorial Hospital, all of which are willing to provide the first pilot to participate in the first pilot project, whereby we actually produce and access enough food to be able to provide our local institutions as well as our community. Ultimately, we can feed them locally if we need to, and when we want to. So in order to do that, in order for our food system to advance at all from where we've gotten, which we're doing quite well, primarily what we're needing food processing systems that can raise us to the upgraded level of food safety that would allow us to provide food not only to local restaurants and the Big Hollow Food Co-op and the farmers markets and one-on-one sales, but would permit us to actually provide the food to the school systems, including the university and our local school systems, Ivinson Memorial Hospital, and so on. By doing that, we're not only creating more food security, but we're creating more jobs, we're creating more economic development, and these also will now include revenue building that will help Feeding Laramie Valley sustain itself and will help the entire food system sustain itself. So we've tried to go in from a number of angles to address all of this, while also continuing to address equity and diversity through our wage system, our wage and benefit system, and also through our community engagement. Most of the people who participate in our programs turn around and volunteer back. As I said, our volunteer numbers have greatly increased. We can't even keep up with it. We have to schedule people several weeks out. We have large groups coming in. And part of the reason people are so excited about participating in this is because they too are eager to contribute to something that is going to be long-term and ongoing. That this is something separate from and beyond all the amazing emergency services that are provided in this community and that absolutely need additional support and need to continue to grow. But over the long term, we should be able to reduce that emergency need if we can really increase the sustainable structure. So this project request, as I said, is a bold one, but we've been working on it for 12 years. It's not brand new for us. We already have a mobile market that has been funded and ready to renovate. The bus is being renovated for this market. We're getting ready to launch that program in the spring, which will help with distribution and access in a whole new way. This project will help us establish the first modular food processing unit. That way we can collect all of the produce. For example, let's pick on spinach. Let's say spinach, which Albany County was known for exporting that many years ago. We can gather all the spinach from local producers, as well as homesteaders, as well as gardeners, all of whom can either make a small amount of money or a large amount of money. And then we can bring that together, aggregate it, process it so that it is suitable for use at institutions and at the larger grocery stores. For example, we have people who are able to sell their food to Big Hollow. They're able to sell their food even to Whole Foods in the region, but they do not have the system that would allow them to either produce. They could produce enough, but they can't process enough and do it in the safe way that's required by law in order to be able to say sell to Walmart or Ridley's or Albertsons or Safeway. So all of this is about a one-time investment to begin that infrastructure to help us take the next step toward a truly sustainable, as well as helping us helping us all to recover from how the pandemic has hit us and continues to hit us. And you've been hearing those stories this morning.
Thanks,
I
Gail.
have more, but I want to be mindful of the time.
Yeah. Thanks, Gail. Any questions, commissioners? Gail, when you say food processing unit, are you thinking vehicle? What are you talking about? A warehouse? Some sort of what does that look like?
Yeah, so where we need to go is we're going to need a building. Ultimately, it's going to need to be to do this full scale. We've got that. There are funds out there for that. They're waiting for us to get to that step. We don't want to we've also been doing a lot of research and networking across the country with people who've been doing food hub work for decades. We don't want to make the mistake of going forward in taking such a huge leap and too quickly that we will economically fail. So we want to build it the way we have built Feeding Laramie Valley. I think we can go faster than 12 years. I know that we can, but by creating something using resources we already have, but just adding to it. So by beginning with a mobile unit, we actually already own several modular units we've been using for a variety of things that would be easily, so we have some of that would be easily renovated. So we could create a processing unit that would utilize a modular and probably a shed system so that we can practice with all this. We can do in the first year, we can do a pilot program. We can see how it works for the ranchers, for the farmers and gardeners, and for Ivanson Memorial. They've stepped up in a very excited way, would love to be part of testing this out. And so this is sort of the intermediary step. Then we would still have that to use as we would continue to be writing the grants and getting the infrastructure investments for larger. We have a number of empty buildings that would be very suitable for a food hub, but we want to make sure that we know how to bring in the revenue and we know how to live up to the needs there.
Thanks, Gail. Appreciate it. Commissioners, any other questions? Awesome. Thanks, Gail. Good morning. Next up, my front door. Anybody here from my front door? Hi, Brenda. Good morning.
Good morning, Chairman Gosar, esteemed commissioners. Thank you for having us. We submitted a concept for renovating a property that we own as a result of a merger with Habitat for Humanity of Albany County. It is a home at 904 Colorado Avenue that we hope to use for our offices and model home that is right next door to the next units that will be completed in our community land trust. Our program, actually, the focus is financial literacy, and the end result is home ownership and that economic mobility along the way. One of the things that we ran into with COVID is that so much of our program is hands-on, both in a group and a one-on-one setting, that we then moved digitally. We were very fortunate not to have anybody be in danger of being unsheltered or suffer from scarcity in our program during COVID. However, we are now moving back to in-person kind of services, and our downtown office, we no longer have that. One thing that we found is that it was inaccessible for folks with disabilities, as it had a staircase and no elevator, and several of our clients do have those kinds of needs. And we knew it would be a need going forward, so we decided that we would use the home that we acquired and renovate that for our classroom, and we would be able to not have to strain the capacity of our community partners. And we also wouldn't be kind of susceptible to the insecurity of not being able to schedule when our clients aren't at work. So sometimes they have to meet at off-peak hours, that kind of thing. We hope that these classrooms in this building going forward will be kind of a nice place for our community partners to use as well. I know that Josh and Cole have been wonderful community partners for us in being that kind of continuum of care. They really bring stability and bring those folks along that housing continuum. And we are kind of that next organic piece of the puzzle and taking folks from survive to thrive. So we kind of provide that next piece on the spectrum. I think, one of the things that we provide is that foreclosure prevention and taking folks and that are from 50 to 80% of area median income, which is really 40,500 to 64,800 for a family of 4. That's kind of where our families sit. And so foreclosure prevention, teaching them how to be stable once they do own a home. So they'll never be in the position where they're foreclosed on. We also provide that eviction prevention by teaching them how to budget and set and achieve SMART goals. We really hope that this will provide that ability for us to stabilize our presence in Albany County and start building the future for homeownership and economic mobility.
Thank you, Brenda. Any questions, commissioners?
I have.
You have one too? Okay. Brenda, thank you so much. I appreciate it.
Thank you, Commissioner.
All right. I guess we'll drop down and talk to you guys in a different perspective. Is Salvation Army here today yet? I don't see a person on.
I sent them a message and didn't get a response back. But I think from reading their statement, it was more in support of some of the things that they were voting for because they did not ask for a dollar amount. But they have been very vocal about supporting Josh and Cole's efforts within the transitional care.
Awesome. How about Cathedral Home? See anybody that I? Okay.
Mr. Chairman, it sounds like on the housing front, there's some unity as to purpose and not a lot of duplication or overlapping, which is probably a good thing.
Yeah, would you like me to answer that or?
Well,
It does seem that way. Bailey and I did yellow some of those things because there is some questions. There's a statement at the very end of the guidelines that says something about like the uniform administration requirements will still apply. So there is some more questions that have to be asked about building purchases and like that type of thing. But yes, for the nonprofits, there does seem to be some unity in a lot of these different projects. Thank you. Sorry, Pete.
No worries at all. So commissioners, I'm going to talk to you about the downtown clinic's request for $45,000 for vaccines, point of care testing supplies, and equipment associated. Our vaccine program started some 4 years ago with there's a program with the CDC and the State Department of Health for low-income uninsured people to have a full complement of vaccines. The 50-50 cost share program with the Wyoming Department of Health did restructuring. They eliminated that program. We've been providing those vaccines for the last couple of years. And it is about $20,000 or more each year to provide those vaccines, flu vaccines, shingles vaccines, Tdap, the full complement. The return on investment of vaccines is well known. And so we think that is essential to our care model and prevention for the non-essential workers that we care for. Also, we are one of the first free clinics in America to get a point of care lab testing facility. In fact, just yesterday, I was doing some testing on that. We have to run those tests every month to make sure that we can provide those services to our clients safely and people can make care decisions based on our lab instruments. As you can imagine, those instruments were provided for free, but the reagents were certainly not. And all the equipment that goes along with that. What's really neat about a point of care facility like ours is a person like me without any healthcare experience can be trained to run that. And we can provide real-time lab testing for clients while they wait and while they're working with a provider. So if they ask us for an A1C, 6 minutes later, we can provide that through the door and they can make a determination about insulin and other treatments. And then the durable equipment, you may or may not know, we have a wearable technology division. We believe that healthcare for low-income uninsured people should be innovative, creative, and high quality. So we do have a continuous blood glucose monitoring program that we put on people that are not only diabetic, but pre-diabetic. For those of you not familiar, you wear a sensor for 14 days. And if you swipe this cool little gadget across the sensor every 8 hours, we can download 24 hours of your blood glucose levels for 2 weeks. As you can imagine, an A1C is a 3-month test. That puts us about 3 months behind a person's disease state. Continuous blood glucose puts us in real time. I was able to wear one just to see how the project worked. It was really cool to understand the difference between Cereal, not Lucky Charms or any of those fun cereals like most people would like to eat. Mine is plain old cornflakes, and the difference between eating that and eggs to your blood sugar level. And Heber probably knows much better than I about all that, but we're hopeful.
It's the old glycemic index.
Yeah, it was really cool to learn. And we're hoping that we can put those on people through screening and provide them with a way not to become diabetic if they're type 2 on that path to type 2 diabetes by understanding their disease in a much different way. So that's the sum and total of it. Any questions for you guys?
I have a question. So you were talking about the sort of the match model for funding vaccines, and the total bill I think you said is 20,000. So it used to cost 10,000, and now Downtown Clinic is funding all 20. Is that the basic?
We used to get it for free because we qualified as a vaccine distributor for low-income uninsured people. But when the state eliminated that program, the CDC eliminated their match, and so now we buy those vaccines directly from an at-cost provider. And so our take is from 0 to 20,000.
So the match happened before it ever got to you. So it didn't cost the clinic anything, and now it costs the clinic all of it.
Yes.
Okay.
Yep. It cost us some fridges and freezers and some training, but other than that, nothing more than that.
Additionally, how do you continuous glucose monitoring supplies are expensive?
Yeah. And
I was just curious how the Downtown Clinic procures that, given the cost. The scanners and the data collection and that stuff isn't so expensive, but the actual devices are. And I'm curious how you go about doing that.
Well, we had a grant initially to start the program, and you figure out the program fairly quickly when you're on paying for it after that. And so now we have been paying for it, but screening people, so not everybody who's diabetic in our program will be capable or interested in using that device.
Sure.
And so we screen people. We have now a 3-week training program. So the device goes on, they meet with the nurse and discuss what we would like to see and what they would like to do with it. A week later, they're talking about, is there any problem with the device? Is there something that they would like to know more about? Take a look at the data. And then at the end, when we take off the device, they have a readout and another consult with a dietitian and a nurse about what they learned and how we can put that in there. The quick question is, we've been buying them because we think it's important to understand real-time diabetes, and A1Cs don't do that for us.
Right. They don't do it for anyone.
No.
So the program, I guess, is set up that you use it as a teaching tool for somebody to learn how to eat. And we probably all need that, right? Because just because your body can make enough insulin in a moment, doesn't mean that it should, right? And probably the way we eat when it comes to empty calories really challenges our bodies without us knowing until we cross that threshold, right? And so I'm trying to imagine, are you saying that you just do that as an educational thing for the 2 weeks, or do you have some clients who have the monitor on all the time for weeks, months, years, as a tool to take care of themselves?
I wish we could do it weeks, months, years. We don't have the funding to do that. And so it is a training tool, but it's also a prescriber's tool.
Yep.
So that our docs, that information is downloaded to our electronic health record, and providers can now make that determination. Is their insulin where it needs to be? Do they need to start on insulin? And what I really think is interesting is we have a certain amount of illiterate people, both in English and Spanish, that we see. And even though we have tried to produce educational materials that is just visual, it's amazing how little somebody might know about their disease after 10 years of having it explained in their language or visually. It's really difficult. This is one of those things where they can just swipe after breakfast and take a look and understand in a number way how that breakfast impacted their diabetes. which we haven't been able to cross that barrier for 10 or 15 years with people.
Sure.
Just another way to try to get people to learn.
If you eat the typical hunter-gatherer diet with not so many carbs, the standard deviation is a lot less than if you eat a lot of carbs. So somebody who's not diabetic doesn't mean that they aren't really challenging their body when they eat empty carbs. You just don't see it till you see it, right? And I'm going to guess that that's what happened when you wore the thing. You're like, oh, wow. You know, so even though your body tolerates what you do, it's not the same, you know, of course, a person's ability to think, focus, concentrate, all of those things too. It's pretty interesting.
Well, and it's interesting that we try to get people who put one of those on to get into the rec center and see what happens when they exercise or when they walk around the block, because that was a little surprising to me when I went to run. What happened to your glycemic index, and then spiked, and then as it came down, as you got further into your, I feel like I have an idea about health, but I was learning all the time, and so I swiped the heck out of that thing for 2 weeks just because I wanted to know.
Oh, did you challenge your body in all kinds of ways?
Yeah.
Like super sedentary and,
Yes, it was really interesting.
and trashy, and then super healthy and active.
Yeah, and we had providers who did it as well, because you need to understand what a client's going through and what may or may not be useful to that tool. So we really try not to over-prescribe the tool because it is so expensive.
They're
we try to get people who are ready for that challenge and then support them with nurses and providers. We don't want one pre-diabetic to go to diabetes if we can help it. I think that system should be that way also.
Pete, does this clinical durable equipment also include blood pressure cuffs and monitors and the CPAP machines?
It will require some of the CPAP machines, not the blood pressure monitors. We have those already in place, but we have a medical oxygen sleep apnea clinic also, where we use donated equipment, but occasionally from time to time, we don't have donated equipment available to us. And so we put people on a payment plan for a medical oxygen, a concentrator, right? It might cost $600. There are places we started to help them fund these concentrators, and we soon realized it wasn't sustainable for us or the client. So a $600 concentrator might go for $120 a month, never owning. They would never own that piece of equipment. So we buy the equipment, give them a $3, $5, $6 a month contract. Something that doesn't remove them from housing, doesn't get in the way of their eating. So they can have, at the end of that payment program, a piece of equipment they can not have to pay on forever. It fits into their sleep apnea and their medical oxygen needs.
Well, those things can take away a person's ability to think, function, be productive, right?
Yeah.
And then their situation, despite their intentions to help themselves, just keeps getting worse because they aren't healthy enough to do what they need and would do if they could. The rental of those things is a racket. It's a complete racket.
It was unsustainable for us, so we had to do a different model.
It is unsustainable for anyone. I mean, unless you only need it for 10 days, but yeah. But if you need it for a long time, it makes no sense to rent one.
Any other questions?
No.
Thanks, guys. Appreciate it. All right. Any takeaways, Sue, overall? And then we'll go to Heber, and then for me, I might have a couple too.
Yeah.
So.
First, Evelyn, I want to thank you and Bailey for going through this and not even bothering to put forward anything that was not eligible, and giving us a little bit more of a direction here and all. So thank you for that pre-work you've done. So like all of you, I'm sure you would love to be able to find all these things, but I think there are, these green ones are green for a reason, you know, and I think those should definitely receive our priority as far as funding and all. I like the idea of some of these where it's going, but they could obviously need a lot of other grants and funding to make it possible. So I don't know how you want to proceed. You said you had some questions, but we want to prioritize.
Yeah, no, but
I'm
please.
sorry. So Bailey and I did come up with a system for you all if there's more information that you want. And Bailey may be able to speak a little bit more towards this, but our thoughts were if you have ones even that are yellow that you think you might be interested in, that we would then reach out and have more extensive questions. A part of the reason why they're yellow is because we just have questions about, is this a match for a grant? Because there are regulations that you can't use it for matching some federal funds. Would it be used towards this area or that area? So it's not that they're not eligible. We just have a couple more questions that they could very easily clarify. Or the scope is so big that they would need to go through a granting process. We did this because we didn't want, not knowing what would come in, writing a grant is so extensive, to have them write a grant and then be like, nope. And so that's why we did this first. So that is a possibility, should you all.
So this may need to be an intermediate process. This isn't like the end of it. I mean, based on what I was saying, I just see that we need more information and there's going to be some sorting that has to go on. I mean, there's a possibility that there are some that we would agree with the purpose, but if the details can't get hammered out by the deadline,
exactly, then
the opportunity goes away just because it's too broad or too hard to write the grant or
yes,
right.
Yeah.
So to me, I don't see anything that, you know, I'm not, I guess, prepared to eliminate or sort through any of them right this minute, just because I just don't know that we're at that place yet.
I think the other thing too that Bailey and I noticed, and this is just from me having read through the guidelines and everything, is that you all as a commission deciding on, so I'm just throwing an example out there, right? A lot of the organizations ask for wage gaps, right? So as a county, if you guys decide that like wages is something that you want to focus on, that helps Bailey in her reporting back, right? If you decide you want to focus on public health, if you decide those types of things, grouping them helps her in her report and also justifying, because a lot of the guidelines are pretty vague. And so really basically what sparks your interest, if you want more information, we will get it for you. And even if it's yellow, it's not, that doesn't necessarily mean that it's not possible. Sorry, that's so vague. It doesn't really
Sure.
at all.
Yeah, well, like, so the example you give, wages, the problem is that it's one-time soft money, right?
Right.
So any organization who, this is my opinion and it may be theirs too, but you know, this isn't necessarily seed money for a legacy cost that can't be sustained. In other words, the organizations who want to do that, I actually don't have any problem with it. They would just need to understand that they might be creating a tougher situation for themselves down the road, because the way that the funding and the types of funding and what it's for that comes to this commission, you know, we probably or definitely can't, you know, be the well that they keep coming back to. This is sort of a one-time thing. And I think that's why the chairman asks the question that he does when he does. And thank you for asking it, but I don't have to. So yeah, I personally, I don't have any issue with those. I just wouldn't want somebody to structure their use of it such that it would go on, or that they would expect for it to go on forever without having to find an alternate way to fund it in 18 months.
And I think most of them are pretty much well aware of that, having lived in a grant funded world and your salary is grant funded, you know that it could be there one day and it could not. So I think they're aware of that. But I do think, like I said, there's possibility across the board. And that we're more than happy to go get you more information should some of the bigger projects spark your interest. You know, I personally feel that these ARPA funds are an opportunity to reach out to our community, and I think that's big.
How much have we allocated for nonprofits?
Well, according to the spreadsheet, it would be of the green, be 1,300,000, almost 1,400,000, if these were all funded at their present levels in the green.
Okay.
And it would be 1,600,000 in the yellow for nonprofit. So, maybe not to add more. Yeah, go ahead. Bailey, go
Sorry.
ahead.
Good morning. I am home with COVID, unfortunately, and a sick COVID kid. So I'm sorry I'm not there in person. I do just want to let you know that after I've kind of heard a little bit more about all these projects today, there are a few more that I have concerns about that we originally labeled green. Mainly some of those salary pieces, because in the guidelines, it specifically says it cannot be for raises. It also talks about you can use it to hire people on, like to help that incentive portion, but that I believe is mainly for your government employees, not necessarily the nonprofits. So that would be a piece I would need to do a little more research on. But this was really a snapshot of what the nonprofits were thinking of doing, which was a great way to start out. However, then I think moving forward, like I said, some of these greens that we labeled, I don't think are green anymore, and we're going to need to do some more research. So the number that I then included on your worksheet, that 1.4, probably isn't as accurate after we've heard everybody speak today.
It'd be nice if they could just bullet point how they were gonna, for instance, spend 45,000 in the downtown clinic. How would we spend that, right? What would be for vaccines? What would we be for point of care lab reagents? What would we do that, right? And that would be helpful.
That's the same thing that Bailey reaches on. We did a little bit of research as far as purchasing and using the money for rent and those types of things, or purchasing vehicles. And Bailey, correct me, the vehicles is more likely, but the building is probably, it falls underneath of like that standard restrictions that would. Is that correct, Bailey?
Yeah. So, I mean, the research I've done, and because we have to follow OMB, which is now CFR grant guidelines, the purchase of property, in my opinion, is not something I think that the county as a whole should possibly move forward with. It is a possibility. You are allowed to do it. However, it opens up a whole new door that technically the feds own your building. And when you go to sell it and you're not using it for the purposes you originally bought it for, it's going to be a huge pain in the butt. However, vehicles, on the other hand, those seem to be okay because they fall under the equipment. They don't fall under real property.
There's a lot of stuff in there. And we've been trying to figure out some stuff out, but.
Well, if we could get just a little more detail, and then I started listening, and the bundling to me was really an interesting way. I broke it down to shelter, resources, food, healthcare, transportation, and some of those entities maybe get together and see if they could co. Some of it won't work, right? Because Jessica's premium or pay for the services at hospice doesn't really impact us, but maybe downtown clinic and Laramie Reproductive Health can get together and come up with an idea or support each other's ideas in a different way. Maybe that's a way to go to combine resources.
So maybe hazard pay has to be one time. It has to be like a stipend as opposed to a salary type thing.
Yeah.
Maybe that can pass muster where salary cannot. Somehow, I suppose, we got to refine what's allowable and feed it back to the nonprofits. I guess my question then is, what's our deadline? How much time do we have to work on this? And like, how fast does the turnaround have to be for us to do this again?
Well, I think Bailey would have to maybe recolor code it with Evelyn for us. But this money doesn't have to be expended. It has to be expended by the end of 2026. Is that correct?
The money does have to be expended by 2026. However, it has to be obligated by the end of 2024. So we need to have everything sorted out by then. It just kind of gives us the extra 2 years to like broadband, for instance, for Adam to finish that project that he's doing, even though I know he'll have it done before. But everything has to be decided on before the end of 2024.
So time is on our side.
Yeah,
Time is on our
Yeah.
side.
but sooner rather than later,
Yeah.
right? Put the money into our economy. So,
So just to be clear, what you would like from me is to reach back out to everyone, to group them possibly into areas to see if there's some collaboration that could occur, and then ask for a budget breakdown from each one. Does that work?
yep,
Okay.
that sounds great.
So, right, so more detail in terms of, and then maybe even before it comes in front of us, then that gives you and Bailey the ability to sort of filter and make counter suggestions based on the legalities of it, right? We probably need a more finished product.
Yeah, our hope was that off of some of these summaries, you might be able to like cut it in half for us, was our hope, but I also understand wanting budgets and everything and more information as well. Just because of how many great grants all of these individuals write and their time, that if there was something on there that you saw and you were like, no, we were hoping that might.
Well, and then there's another question, Mr. Chairman.
Sure.
So as commissioners, if we sort these, and sort of give the yay or nay, I'm trying to figure out, I guess we have more requests than we do available funding, and that's why we need to sort. I mean, otherwise they would be able to stand on their own merits in terms of how the feds would view them. So I tend to, if I'm gonna apply some filters, mine would be similar to yours, Mr. Chairman, and that would be things that are related to human health and survival. Basic human health and survival. So if I go down the list and I look at things that I think fit that, I would say that I don't think relative theatrics fits that. Cyber Wyoming Alliance may and may not, like that's, because you have to consider the cost of not doing that. And what the cost could be to those organizations if they're reactive rather than proactive. Does that make sense?
Hey, Bailey, you seem like you have a pretty decent idea of, after hearing these presentations, may or may not be green, yellow, and then send that back out to us at some point.
Yeah, I think I'll get with Evelyn. I mean, like I said, I'm home and now it's till after Thanksgiving at this point. So I can reach out to Evelyn and her. I can have a Teams meeting and go over things because I know there's a few things I missed. Hayden was a little fussy. And just touch base with her and then resend that out to the commissioners. I think one of the things maybe I was hoping for, because like what we did with the county requests, you guys were able to say what was a priority, what was not a priority. And I know you guys mainly went off my green and yellow. But if you want to wait for that, I certainly can do that. I just don't want to waste anybody's time. I mean, everybody's time is valuable. I know mine certainly is at this point. Evelyn is, and Evelyn's been a huge help, and I'm going to continue to need her help on this. But I can certainly get with Evelyn, hopefully later this week, and I'm feeling a little bit better, and at least go through some of what different points people were making today as they were speaking and kind of narrow it down from there. And I can get that back out to you guys. And then maybe we can get a yay or nay on what you guys want to move forward with looking into. Because I just don't want to waste anybody's time is my biggest thing.
Yeah, and I don't want to ask any more than just let us understand the ask more than we did today, right? So if there's 20,000 in for salaries and we don't think we can do salaries, then we need to, then it'll kind of self-select the person's request down, right? And if we can't do buildings, then we can't do buildings, right? It might be a great idea, but we just can't do buildings. And then that will reduce those things down. And if we have an idea of what those budget items were and how much they were planning, and we'd be able to cut those down based on what was approved and what wasn't, what would fit and what wouldn't fit under ARPA.
Yes, I mean, I'll certainly do that, and I'll get together with Evelyn later this week, and we'll narrow that list down, recolor coordinate, and I can get it back to you guys, hopefully by the end of the week.
Thanks. And Ted, you look like your video came on. Do you have something to talk with us about?
Yes, Chairman Gosar, if I could just make a comment real quick. So I was unaware of the timing that you were discussing. If it's not that the funding won't be allocated until 2024, we're going to have to go to completely different sources. I mean, we're talking about, are we saying the soup kitchen is going to stay closed for another 4 years before we're able to purchase the equipment we need to reopen? The other part of it is just reading from the fact sheet. I know that there's far more to federal grants than this, but it specifically says provide premium pay for essential workers. So I agree with you that it's the one time, not the ongoing expenses for personnel costs, but it also specifically says that it actually encourages the payment of retroactive pay. By 2024, it's a good chance that none of the individuals who, as it says, born and will bear the greatest health risks because of their service, they won't be working for the soup kitchen any longer. So I would hope that you can set a deadline for distribution of the funds that's far earlier than 2024. And otherwise, I think that 90% of the requests that you heard today just won't matter.
Well, 2024 is the deadline, Ted, but I suspect we could get it the first quarter of 2022. That's what I would point towards, at least some of them. You know, but we have a difference between premium pay and salaries. And those do matter when it comes to ARP, is my understanding. And so, you know, filtering that out is something that I would like to do, so that we're not contrary to what ARPA would fund.
I do appreciate that. And that's wonderful. And I do appreciate your commitment to getting these funds out to our agencies earlier. We could all really use the support.
Yeah, to be clear, I didn't mean that we would use all of the time available. My question was only like, are we pressed, or can we wouldn't want to get in a situation where we take liberties in the applications that upon further audit would get us or the organizations in trouble. You know, the process has to be legal enough, and there enough scrutiny has to be applied that nobody winds up having to return funds, because that could be really challenging for a nonprofit to find money to return already spent money. That would kill them.
Commissioner Gross, would it also be okay for me to present on United Way with, I asked Bailey to keep mine separate because I felt awkward managing my own request in the request that I was also helping.
Sure.
So United Way is asking for assistance with the collective impact study for data, and also contracted support for 2 years to run the program. United Way has put together a coalition right now, 15 members, hopefully 25, including community leadership and individuals across the community, to take a look at systemic issues. We have already started this data collection process because we didn't have enough money to do the full dive. And so each of the data collection process is focused on the 5 areas of backtracking. I'm sorry, everybody. Social determinants of health. And due to funding, we had to limit that down to 3. And those are economic stability, education access and quality, healthcare access and quality, neighborhoods and built environments, and social and community context. The reason why this is so important, right? During COVID, and all of this money is to improve disparities brought by COVID, right? The problem is when you can't fully address and identify with data those disparities, right? When you ask each one of us how many people are experiencing homelessness, how many people are hungry, what does it look like? That information is here. It's just spread out in our community. And so the goal through this request is to do a more in-depth dive than what's already been done, and to have a professional compile it so that a consistent community message can go out and over the county, so that we all have access to this information. It's all there, and not just access to what is presented to an agency, but the actual raw data. So by contracting through WISAC, WISAC would then reach out to the hospital and ask for the hospital's raw data on the community needs assessment. They would reach out to the university and ask the university for their raw data based on their drug, alcohol, and suicide studies, and then putting all of those together in one place. Due to funding, we weren't able to access that raw data. We were only able to access, what was officially presented at the end of a study. And that's what we're going off of right now. But this would help us to be able to create a baseline that any nonprofit, any organization could use when looking at the overall health of a community. Any questions?
Mr. Chairman, are there enough raw data points
There's so much information here.
to put together a sufficiently, a non-pixelated, picture that has enough resolution?
So there is so much information in our community between the university, the nonprofits, or government agencies. There are some gaps that are missing, and a part of collective impact is over the year you regularly do this every 5 years to see where things are changing. And a part of that, what's missing is that actual, it would include a component of reaching out to community members and to getting their information and their input into these areas as well. So making sure that that's up to date and it's continuing. I don't like calling it a community needs assessment because it's really taking what exists and getting that picture put together. The data right now is siloed. And we've talked about this in some of the COPSA meetings and other places that we all have this great research, but it needs to come together to show a full picture of what's going on in our community. And that's needed to address concerns that arose from COVID.
So it's not a needs assessment, it's just an aggregation of data.
Yeah. And
it would be interesting to see how disparities or contradictions in data are reconciled,
and to
right?
have a professional put it together in digestible information that the community can then see it. And that's where WISAC comes in as well. WISAC would also be willing to host wide community meetings to educate on what actually this data means and what it's saying about our community as well for this funding.
So it would be just the data collection through WISAC?
So it would be that part, and then it would also be the other side of it, which is a contracted work for 2 years of an individual to run this coalition. You hear all of the nonprofits come together and they all have such wonderful missions and they've been fighting so hard for things. The goal of this coalition is to get the community to fight for them and with them. And it needs someone who's strong to bring community members and leaders together to rally everyone behind these efforts. And there is funding available out there in the universe. Unfortunately, with these types of coalitions, they want to see that you've succeeded, and then they'll fund you to further what you're doing. So it's more so, it's in place, it's working, we figured this out, and then they'll provide additional funding.
Well, we have lots of success, but it's disparate success because it's not within the model, right, that we're talking about.
Yeah.
So it would be challenging, I would guess, to say, here are our disparate successes, and if we change the model, the success would be greater. I mean, to me, I don't see a lot of failures of the nonprofits to leverage volunteerism. If you looked at the dollar value of what they put out versus what's put in,
yeah,
it's way more efficient than government.
Yeah. But this data would also allow them to leverage other funds, right?
Yeah.
One of my primary examples is when I first started working at Family Promise, I went into a meeting and someone stood up and said, well, where do most of our homeless populations come from? Like, what are they suffering from? And myself and several other organizations were there and we all had different answers, right? and it's just a part of life. It's what you work with, right? And the true answer is it's from all of those issues, right? Like, but I do think that having information put together and providing them with the data that they need, that county could use, that the university could use, that the hospital could use, would be invaluable as far as accessing money to create change, or actually even just tracking what's going on in our community and what's changing, and if the impact.
Yeah. Any other questions? Thank you, Ellen. Appreciate it. Thanks for your help on this. So in the 13 minutes we have left, I'm not sure how to work with the county here without wasting you guys' time. Bailey, does everybody have access to this spreadsheet? They do, don't they? Does everybody have access to this?
I can share it.
They actually do not. It's something that's on my drive. I can certainly send it out to everybody if you would like.
Yeah, what I would like to do is those that are green, I suspect will just need not much more. But if there's something in yellow or red that you don't feel like should be yellow or red, could you help us figure out why it's not yellow or red? So could you point it to whatever ARPA funding or part of that act that would be helpful? I know there's different interpretations of it. I'd like to hear your perspective on that piece. And then maybe we can figure out how to prioritize this, if we actually have the green right, or if the yellow needs to be part of the green and the red needs to be part of the green, so that we know what universe we're working with when we go to decide funds. Does that sound like a reasonable approach to this, or is that just one more thing that you don't need? Bailey, is that helpful?
Yeah, I mean, that sounds perfectly fine. The reds are, I mean, I labeled them because I did the research. AEDs, we decided just don't qualify. They're not COVID related technically. So they're saying that they don't qualify. The medical contract, the more and more I'm looking through these guidelines that we do have right now, anything incarceration has to be related back to COVID. And because ours would be a general contract for general medical, I do not believe it would qualify. I'd be open to talking about it though, if somebody else has a different opinion on it. And then the solar panels and batteries, this funding just is not the right fit for that particular item. So those are the three reds in the priority portion. For the yellow portion, some of them I really just need some more information. The MOU with the city, I just don't know enough about it. So I need to get with somebody who does. The county, you guys had brought up the countywide broadband. I need to know a little bit more of what you all are thinking in regards to that, because it is just a general statement at this point. The Albany County Early Development Coalition, Rachel sent that to me just last week. I hadn't had quite enough time to go through it yet. That was my biggest thing. And then the nonprofits we're working on in a separate thing. So those are the reasons for those at this point. But if people can get me some more information, I would be happy to look through more. But I think at this point we need another meeting date.
Yes, I know. You read my mind. Commissioners, any ideas for the first part of December? After Thanksgiving, before Christmas, anything that you can't do, or do Mondays work for you better than, or is there some day better than other days? Obviously Tuesdays are not a great day.
Mondays look great throughout December.
I'm good in December.
Okay, on any day or just Mondays is?
All of them.
Okay. Jackie and Kayla, Tracy, Adam, any of those that we're missing that you guys know about that we can't make happen for us?
I mean, I would say with the exception of Friday, because that can be tough.
Bailey, what's a better day for you? I know Monday was a tough day for you. What's a better day for you, if there is one?
This Monday just happened to be a little more tough because I was out of the office Friday. Most Mondays, I mean, are fine with me if they work for all of you. What about Monday, December 13th? If you guys would like to still do a Monday.
Sure.
Okay.
How about 9 to noon on December 13th?
That works.
Okay.
That'll give us a month to get hopefully a few more answers for you guys, and then we can hopefully maybe start making some decisions and moving forward.
And commissioners, if you could work on this sheet yourself and say, well, this is something that I may be able to do, or this is a bridge I can't go down, then, or this is a bridge I can go halfway down, then that would be a useful strategy for us to start a conversation on the 13th of December about that information. Does that sound like a plan? We just December 13th, 9 to noon would be a work session again about ARPA. If you have a yellow or a red and you want to show us the light, please help us see the light and the wisdom. And then we'll convene on that Monday, and we'll start with county, and then maybe we'll have a different idea about nonprofits on that too. I don't know. We'll see if nonprofits, if we have enough time for nonprofits. So, does that work?
Yeah. Commissioner Wilson, I want to apologize to all the county staff here today, department heads and all, who sat through this whole thing. I didn't think it was going to take as long as it did with the nonprofits. So thank you for your patience. I know you feel like, well, what was the point of us being here today? But we were hoping that maybe we have a little bit more time to talk through your request and all. So I want to apologize to you guys, because I know it ended up being a big burden on you guys to sit here and then not even be allowed to or have the time to represent your request. So hopefully the 13th, we will start with the county, and then if there's any more time, we'll go with it.
Thanks, Commissioner. Thank you, and sorry about that, guys. I just thought it would go this long. But, all right, anything else? Yes, Chelsea, please.
Sorry, just a minute. For my request for the aerial flyover, in order to get the price that's listed, we would have to have the contract signed by the end of the year. And I realize this is going to be a process, and I appreciate the process. Would you like me to get a new estimate?
Hey, Chelsea and the commissioners.
Yeah.
Because this is the federal funding, we do have to follow our procurement guidelines. So with anything, and that's over the $25,000, it has to go out for RFP. So it's not just a contract that we could sign right away. It's something that would have to be put out for RFP.
Okay. I have a question.
Sure.
Do we have to aggregate all of the projects, or can we trickle them in as we're satisfied that they're a priority and they're complete?
I think we can trickle them in, don't you think, Bailey? And we only have half of the money at this point. So we only have $3.5 million, or 7 at this point. So we wouldn't want to dole out $7 million, because I don't think our budget would withstand that until, when's the second disbursement? Is it next June?
I believe it's actually December.
December of this year.
I was trying to find a date, but I haven't found the actual date where they would start dispersing that second half.
Okay.
It would be pretty hard for the RFP, if we were to write an RFP related to an aerial flyover, when it's being done in conjunction with other work, it's pretty hard for somebody to do a standalone flyover and do the imagery without it being part of something else. It would be really hard for somebody out there to beat this cost because it's being done in conjunction with other work. That's why it's more expensive if we want to have that trade. So there could be some value in us expediting the purchasing process, as much as we can, so that get an RFP out so that people have a chance to respond to it. I definitely see the value in this, and there's a lot of value in it, especially, and there's a lot of value in the savings. And I suppose if we don't get the RFP and the responses back in and done, and we still wanted to fund it, it would eat up a whole bunch of money that could be used in other ways, which is a problem. So I can imagine it's kind of pressing to get the RFP out and the responses back in before the end of the year. Yeah.
The other thing I'm concerned about with the projects having to be complete by 2026, with this being a 6-year project, it really needs to get rolling.
Yeah.
I was just gonna say that we can work with Chelsea to address the specifics of what they need and write those specifics into the RFP. So if it has to work with whatever programs and the exact data sets that or types that they need, we can put all of that into the RFP. So, and if it's something that this commission would like to see before the end of the year, we could get it, working with Chelsea, we could likely get an RFP done. And on your first meeting in December, advertise it for 2 weeks or 3 weeks, and then have it either at your second meeting or the special meeting later in December to approve it, if that's what this commission wanted to do.
Yeah. Yeah, Adam, please.
There, in terms of the federal funding, there's a good chance that EcoView will provide you a sole source representation, which I don't know how grants and federal funding work. That's a Bailey question. But a lot of times that will, what's the word? Satisfy the purchasing requirements when it comes to this along those lines. So something to look at, but not a guarantee.
And help expedite your process.
Yes.
Yeah.
If they're sourced through the state, then previously that eliminates our need to have to go out for RFP.
Yeah.
In some cases, if they're sole source, if that works with Bailey.
Okay. Did you hear that, Bailey? Did you hear about the sole source discussion?
I did, and sole sourcing with the ARPA funds, I would need to look into a little bit more.
Okay, cool.
Basically any grant says is you have to follow your own procurement policies. But sole source is a little bit different, and ARPA funds have changed the game in a lot of different ways. So it's something I would have to look into a little bit more.
Cool, thank you. Thank you. Any other questions, concerns? Thanks for your time. Sorry if we had wasted it. Just didn't know how this would go. So
surely there was something to be learned by witnessing the process.
Right. And please let us get your information. If something is a yellow or red, we certainly do want to hear your interpretation about it. So,
Mr. Chairman, did we say 9 a.m. on Monday, December 13th?
Yes, we did.
Okay. Perfect.
Okay. Well, that'll be the end of that. And we will see you all tomorrow night at 6.